I'd like to now call the Budget and Public Employees Committee to order. Madam Clerk, please call the roll.
Alderwoman Boyd.
Present.
Alderman Odenberg. Alderwoman Schweitzer. Alderwoman Sanye.
Present.
Alderman Aldrich. Chair Spencer.
Present.
Alderman Odenberg. We have 5 present. We have a quorum.
We are going to take up our only item on the calendar for today, which is Board Bill number 1, the city's budget. Today we will be hearing from our health department as well as our street department. And with that, I'd like to call up the director, our new director of health, to present the city's health department budget.
Good morning.
Morning. And if you don't mind, I'm going to start telling folks, just because we've had some issues, just to speak in the microphone so that we get recording for folks at home, and make sure to introduce yourself.
Okay.
Good morning.
We okay?
Said I was helping you and I done turned off the extension cord.
Does the board have copies?
I'm sorry, Doc.
It was a bright projector. I know
It was up and looking pretty, but I'm going to give it just 2 minutes, and if not, we have copies for you.
Okay.
Okay.
And for members of the committee here, as you can see, the health department is Department 7110, and we're looking at page 376 of our line item budget book. While we're getting ready here, I was remiss earlier in the week to not recognize that one of the members of the committee, Alderman Tom Oldenburg, has requested excused absence for the week, and so I'll take a motion to excuse Alderman Oldenburg for the first week of budget hearings.
So moved. Second.
Madam Clerk, I believe we need a roll call on that.
Alderwoman Boyd.
Aye.
Alderwoman Schweitzer.
Aye.
Alderwoman Sanye.
Aye.
Alderman Aldrich.
Aye.
Chair Spencer.
Aye.
We have 5 aye votes.
Okay.
Thank you. Yep.
Don't do what I did because I just turned it off.
Great.
I just turned it off, so be careful.
Right.
We're stretching.
Gosh, I should have been doing that with you. Good morning, everyone. Thank you so much for having me. My name is Dr. Mati Hlachwire Davis. I'm the Director of Health for the City of St. Louis, and it is my honor and my privilege to present the Department of Health proposed FY24 budget presentation. Today's date is May 17th, 2023. We have provided for each member of the committee this morning a copy of our slides that are on the desk before you, and we also have the same slides projected. So the Department of Health fiscal year budgets from fiscal year 2022 to 2024. The actual budget in 2022 was $27.5 million. The budgeted amount for 2023 was nearly $36 million, and the proposed amount for 2024 is $32.7 million. When we take a closer look at the fiscal year 24, and this slide is a pie chart that represents the local use tax fund budget by division. As you can see here, the Healthcare Trust represents 30% of the proposed FY24 budget. The Director of Health and Hospitals portion of the budget represents 20%, our Communicable Diseases Bureau, 15%, our Environmental Health Services, 13%, Animal Care and Control, 9%, and last but certainly not least, Families, Community, School Health, 7%. I want to take a second to just orient the board to a part of our budget that you may not be as familiar with, and this is the Healthcare Trust Fund. Previously, this was earmarked for use by the Regional Health Commission to help fund the Gateway to Better Health project since 2010. The project served as a coverage model where thousands of low-income residents were ineligible for Medicaid in St. Louis City and County and could thus receive health care coverage. Medicaid expansion led to the project's conclusion in December of 2022 as it covered residents' transition to Medicaid coverage. I did prioritize trying to fold this back into our budget, anticipating challenges across the board this year. And so you will see that $5 million represented back in our budget this year. This fund is now proposed to cover 16 new positions to support a behavioral health training center and software upgrades to improve Department of Health services to residents and partners, which I will discuss in more detail later. I cannot underscore how important it was for us to support the Regional Health Commission in this way. They are the leader for the region in making sure that people had Medicaid expansion, and as many of you are aware, with the lifting of the COVID-19 emergency federal order, we have quite literally in crisis right now trying to get people re-enrolled, and so we'd like to thank on record the Regional Health Commission for their leadership, and we look forward to a continued partnership in other areas.
Dr. Mahdi, would you mind educating us just a little bit on who the Regional
Health
Health
Commission?
Commission is, just for new members, and just kind of what their role is in the region?
Absolutely. So the Regional Health Commission was born out of the Ferguson movement here in the city of St. Louis. They represent leadership around health equity across public health and healthcare. They serve as an intermediary for most healthcare institutions. As you can imagine, it's very difficult to get communities represented, especially by way of equity for minoritized, historically and currently minoritized groups, and so they provide leadership around a few priority areas. Firstly, and primarily for health equity and health and health justice, but also for policy, data justice, and a slew of other things that they've increased. The Integrated Health Network was actually born out of the Regional Health Commission, and like I said, they provide leadership, connection, interface between community-based organizations and really community and large healthcare institutions, including hospitals, federally qualified health centers, and public health community groups.
Thank you.
Absolutely. Moving forward, I'd like to discuss with you the Department of Health priorities moving into the next year. The Department of Health has worked towards becoming a fiscally sound agency within the city of St. Louis. To date, we have worked to add necessary positions for fiscal management, including, and never before done, an innovative strategy to use unpaid salary money to bring on a fiscal management service, including an accounting manager, an auditor as 2 new positions last year, and then subcontracting with Armamino LLP to update existing processes and develop new ones for improved internal controls and enhanced efficiency. In fiscal year 2024, we plan to add staff to assist the contracting process for the department. This includes 3 contract compliance officers and a contract specialist to continue our goals towards timely fiscal management. We are looking to increase the work started in our new Behavioral Health Bureau by creating a training center to educate healthcare workers with the necessary skills to provide behavioral health services to city residents. This work will also include outreach and support to community agencies already working in this space to assist with linkage to care for residents. I'm really passionate about this, and I want the board to be very clear that the 2 priorities coming out of this post-pandemic era that we have, it will be behavioral health and maternal child health. For behavioral health, we have so many positive, strong leaders in behavioral health who've done this work long before the Department of Health was able to start this inaugural bureau. However, linkage to care and coordination of services continue to be challenging, as they do across the nation. And so we are primed, and my role as the Director of Health for the city is to really fill this gap around coordination of services. The department also plans to continue its goals towards strengthening its workforce development and capacity through regular program evaluations and performance monitoring, and establishing and implementing workforce development plan for the staff. The next few slides are going to be to take you through each bureau, very briefly tell you some accomplishments for last year and specific priorities. So we'll start with the Behavioral Health Bureau, which is new as of July of 2022. This current fiscal year saw the launch of our Behavioral Health Bureau, a partnership with the CDC Foundation, which has helped us launch the work of this bureau, connecting to community partners and curating a strategic plan, a health equity toolkit, a data dashboard for the opioid crisis, and a slew of other interactive maps for data for the city of St. Louis. Those deliverables will be delivered to the city in June of this year, at the end of that contract. We look ahead in fiscal year 2024. The Bureau will continue its efforts in developing and implementing a comprehensive strategy to address behavioral health in the city, beginning with substance abuse and overdoses. Positions for this Bureau are expected to be funded through the Healthcare Trust Fund, previously discussed. 5 of those positions are currently filled, following some hiring delays due to system upgrades in the city's employment process through the Department of Personnel. Moving on to our environmental health services. Our environmental health services saw these accomplishments during fiscal year 2023. The Emergency Preparedness Program procured 2 mobile van vehicles through ARPA funding to be used by the Department of Health and community partners to bring services to neighborhoods. The second is to arrive next week. We are very excited. These vans will soon be wrapped with the department's information and used in the community outreach and service opportunities. We will be innovatively, historically, the first health department in the state to be bringing healthcare to communities using a data-informed approach through our epidemiology department that started with 2, and I have now filled to 10, to bring services into the community starting this summer. Our food and beverage team performed more than 5,400 inspections, including re-inspection, temporary permits, summer food sites through April of 2023 of this year. The food and beverage inspection program also transitions its temporary permits, and the community sanitation program updated its application and inspection standard operating procedures for fumigations. For FY24, we plan to ask the for the department to accept electronic payments, so we will be going paperless. This Bureau's goal is to add this feature to food permit applications during the next fiscal year. We also plan to upgrade the food and beverage program's electronic record keeping, and the Bureau also wishes to procure additional vehicles for the use of its staff, which perform field work daily through the city. Animal care and control, which, as you know, has been a priority but has had long-standing challenges over the last decade. I'll start with accomplishments in 2023. Staffing in the division increased from 2 employees to 7, 6 full-time and 1 per performance. This increase was assisted by a salary increase and the addition of a recruitment incentive for the first time in the department's history. The division has also worked to purchase equipment to aid in officer safety and field work. Finally, the division continues to support its contracted animal shelter partner, providing them with emergency funding and gaining additional support through ARPA. The division's goals for fiscal year 2024 include modernizing and expanding its aging animal control vehicle fleet. It also plans to increase training for existing and new staff to ensure their safety. And then Animal Care and Control also wishes to identify a facility larger than its current location to house animal shelter operations. Through the support of the Mayor's Office, we were able to identify an emergency overflow shelter that we have made available to CARE STL if they so wish to use it. In regards to Communicable Disease Bureau, in 2023, the Bureau launched a new initiative and website called Health Stop STL to access sexual health information, resources, and testing in the St. Louis region. The Bureau continues to strive for case investigation closures and saw 90% of COVID-19 cases closed within 2 weeks. Its goal was 75%. Through digitizing internal processes, the medical records section saw a reduction of paper consumption by 60%, modernizing in alignment with city priorities. Medical records will soon house the records of a community partner, CHIPS Health and Wellness Center, who unfortunately had to close, and it was our department that came to their aid. For FY24, we'll continue to advance our Department of Health Tuberculosis Services clinic work, including our refugee health program. We recently saw the hiring of a new nursing supervisor to guide its work into outreach into the community. The Bureau also plans to connect with residents and community members more through outreach awareness programs that include the prevention of communicable disease transmission, and then use of our new mobile vans, again, funded through ARPA. We also expect to expand its capability for additional communicable disease needs. Family, community, and school health is up next. We saw improved maternal health connections through focus groups, coalition meetings, and referrals for prenatal care. The Bureau assisted with Medicaid re-enrollment education to avoid coverage interruptions. It has also worked with existing organizations and networks to set the framework for future collaborations. We've also received just finalized the NOFA for the Reproductive Equity Fund in response to the overturning of Roe v. Wade to support birthing individuals and persons. We will be able to come back to this board with the full list of people who will be funded. Primarily, the applications were for doula care, which is a priority for the department to support in the next year. In FY24, we will also develop partnerships around childhood obesity, pre- and postnatal services through additional collaborations. We plan to increase community outreach participation, and we'll also use the State of Missouri Title V block grant funds for maternal child health work as we prioritize this post-pandemic, as you heard me say earlier. Very excited about that work. We will have an RFP that we'll be announcing shortly for community health workers in conjunction with our mobile van to bring those services directly to communities. I'll end by just discussing my overall other priorities as not easily represented within Bureau work. First, we are halfway through the first ever health equity plan for the city of St. Louis, which will serve as a model for the region. And after we roll out the first comprehensive health equity plan for the city of St. Louis, we're already in talks to bring it in alignment and partnership with our county partners. We're also moving innovatively into a community outreach, as previously discussed with our mobile vans. City, regional, and state-level public policy is a priority of mine. Coming in, we did not have capacity. I have formalized a structure with Casey Milberg in the mayor's office, with the city councilor's office, and with 2 members of my staff who have policy, public health expertise. And I can announce today a new partnership with SLU Law to provide capacity to review all existing public health policy and to prioritize new legislative policies as needed, especially for priority advocacy areas such as the abominable anti-trans legislation coming through the state. Ongoing work towards internal quality improvement, reaccreditation, and onboarding of new staff and measurement of key performance indicators round out the department's priorities for the following year. I will stop there, and I'm happy to take any questions.
Thank you so much, Dr. Mahdi. And I want to commend you for putting together a presentation for us to kind of outline not only your accomplishments, but your goals for this year. Before we get into your actual budget, perhaps it might be helpful to turn it over to the committee for questions about the operations of the department, going over the presentation, and then we'll go over your budget.
Absolutely.
Okay, with that, members of the committee, Alderwoman Boyd, do you have any questions for Dr. Mahdi?
Yeah, I thank you for coming. I made several notes, and so I think one of them was in regards to, I got notes everywhere, the environmental health services with the emergency shelter location. That's what I had put notes. So where is exactly is that emergency shelter location that you said you had for CARES?
So I want to be very clear. When we met with CARES TL at the beginning of my tenure, I asked them to let me know what some of the challenges were in assisting us through the contract we have with them for animal care and control. They sent me a list, and one of those was space for the animals. The current building is not sufficient. This is not new news. And the number of animals needing assistance in the city, as you know, is growing, and we are literally and have been in crisis for a long time. One of the requests would be a bigger building was their priority, but that takes time, it's difficult to come by, and cannot just be done within weeks to months. So they have been working with Nancy Cross in the mayor's office to try to see how we can support them with a new, more permanent building for their services. But in the meantime, I work to establish with the mayor's office an overflow building. And that is, I'm not good with names, but it's one of the old jail
Workhouse.
buildings. I'm not going to say workhouse because I don't think it's the workhouse, but it's one of the old jail buildings. It is the workhouse? Okay. I get nervous saying workhouse because I know, yeah. So it's the MSI building, which I understand is very large. My bureau chief, Justin Hauser, Rich Bradley, Rick Ernst, all went to look at sections because we don't need that much space. So there's been a space that's been identified that could be used for emergency shelter purposes if they so use. We provided them with funding through ARPA. We had a plan, but their priorities have since changed, and because we're in the contractual stage of finalizing next year's contract with them, I want to be sensitive, but it is my understanding that although they identified that as a priority for us and we work very hard to make that available, they have needs that are more monetary at this time. So we're trying to work to identify their priorities and their needs, even those that have shifted. So the building is there, the construction money is available, the plan for the emergency shelter is in place if they so want it. As of last week, we were told that that may no longer be a priority. So we are working with them to try to meet their priorities.
Okay. And then on the food and beverage and the health inspections, and I've always had a concern on how the inspections were done, and it was before your time. It was always a discrimination on how inspections were done and how restaurants were graded, different from one part of the city to the other part. So have you done something to centralize that or to ensure that and what I told people prior, I said, it's guidelines, it's state guidelines that
That's
we
right.
have to follow. I said, and so when you do it, it's the same for restaurant A as to restaurant B. You can't change because of the neighborhood or the area. So I saw where you were discussing about training. So are you training those health
Yes.
inspectors? Okay.
That is such a great point and a great question. And it's so refreshing to be able to talk about the other bureaus because coming out of COVID, I think a lot of them were forgotten. But let's be very clear. There were no standard operating procedures, really identified policies that were standardized for a long time in the department. And then you overlay that with a historic and devastating pandemic where all my staff became pandemic experts and literally led the city through the worst pandemic of our time, doing the job of 3 to 4 people with low salaries. They must be commended. But what that also did was turn the department into further array without a lot of, I remember when I came in my first week and I was asking for policies and procedures and I'm, trying to get myself oriented, try to look around, and the manager said, we know what you're asking for, Dr. Mati, but we just had to start making a decision between doing the work and documenting or writing it down. That was the state of public health, not just for the city, but for the nation and quite frankly for the world. Public health is in crisis. We lost 38,000 workers at the end of 2021. We spend $7 per capita on public health in the state of Missouri, and we are across the board, 45th to 50th, across major priority public health. We have been in crisis for a long time. Right. So I appreciate you acknowledging that. So having to prioritize COVID and non-COVID priorities like violence prevention, like behavioral health, like maternal child health and others coming in, I'm gonna be honest with you that what you're asking didn't get prioritizations until about 6 months in. But what we have done through that partnership with SLU Law, Casey Milberg, Craig Schmidt, who must be commended for doing the job of 10 people prior to me being here, is we are now using our reaccreditation process. We've got about 10 QI projects to attend to, and one of those by priority being led by Craig Schmidt is around formalizing and standardizing procedures. So Justin Bureau has worked with the state, always has. There's always been training available, standardized procedures and standards, standards of service. But yes, in COVID, those were not easily adhered to. We're working very hard to do that. That's the training you're talking about. But part of it, Alderwoman Boyd, is we were in the 1800s in this city, okay? Everything was on paper.
Yes.
I was mortified.
I know.
I was finding out about bags of money being carried from one department to the next. Like, what is happening? So it's about modernization and standardization of procedures. And through that, you will see the effort. But where I am unapologetic, and you know how I get, I'm a mama bear. You're gonna leave my people alone now. They led us through this pandemic. understaffed. I should have 5 times the size of the department I have. I have 100 people, and I started with 60. So we're getting there, but Justin and his leadership has been phenomenal. The state is working with us, and thanks to this new standardized processes for SOPs, KPIs, QI, you've seen it in my monthly report, I brought in metrics, that they have internal and externalized goals, and now this training, we're gonna get you there.
Okay.
Yeah.
Last question. This is my forte, so I'm just letting you know. I worked this, so I know this whole piece. So the last question I have, and it's a big concern to me with mental health. And I keep hearing our community, I keep hearing people in the community are like, you know, we're doing the mental health, the behavioral health, or whatever, but I don't see it. And so, to me, I'm a person of action, not a person of talking. So my question is, how are we getting to these communities to ensure that they understand the services there? And in my community, I have federal clinics, and so I don't see them promoting or out in the community outreach to say, this is what's there to help you.
And you're right, you haven't seen them because they haven't been there. Because again, transparency is one of my things, as you know, so let's be clear. There was not one person, hired by the Department of Health to do any work pertaining to behavioral health when I joined in October of 2021. The only work being done on behalf of the city of St. Louis were the very few contracts or subcontracts that were available. We had an amazing partnership with leadership from the mayor's office, with BHR, as you know, cops and clinicians, and then the mayor acted and stood up an Office of Violence Prevention, and then I prioritized a bureau. I told her I can't do COVID, violence prevention without one person employed to do it, behavioral health, not one person employed to do it, and every other health priority. So we acted. We stood up an Office of Violence Prevention, and then we announced the bureau. But Alderman Boyd, we're creating a bureau from nothing, not one person. And at the time that I joined the city, the average turnaround time from the Department of Personnel posting a job to a person being employed was 6 months. I am the most hiring director in the city. I hired just under 60 people in 1 year, but the turnover rates are high because, as you know, salaries and the mandated living requirement are challenges. So I knew that that first year, you weren't gonna announce it 1 week and we're gonna have programs flourishing in the community the next week. That is why I went to the CDC with intention to provide a stopgap so that they could build the foundation for a sustainable plan while I worked with Department of Personnel, and the many chances, many thanks to the new leadership there who are acting swiftly. But I gave them requisitions in August. We didn't get people in till a month ago. That's the challenge of the city, right? So you will see that. We have prioritized this mental health campaign for this is Mental Health Awareness Month. We have had education on billboards, radio, TV. Our social media has had them every day. We have now onboarded, as you heard earlier, the first 5 people for that bureau, born and bred in St. Louis, right? People who know these communities. And more importantly, we have established a task force with over 20 meetings with leadership from the very organizations that have done this work in the city for over 6 months. Over 50 people have met with us for over 20 meetings. So the work will come, but I think we have to have realistic expectations of what we can build when it never existed and when there are many laborious processes in the city. And for that, I must say that the mayor, the mayor's office, the comptroller's office, the Department of Personnel have really tried to be great partners to us. It's still challenging.
Okay.
So you'll see them, and I can introduce you to the new bureau chief. She's amazing. She'll be great to work with you. We'd like to start doing in-person town halls, and we'd like to schedule them at in all the districts and come and speak to people in person. There's a lot we can do here. We just needed time. It was a challenge to get anything up and going.
Okay,
Yeah.
thank you. That's it.
Thank you, Alderwoman Boyd. Alderwoman Schweitzer?
Hello, thank you so much for being here. Great presentation. I love how you broke everything down. Made it a lot easier to follow. I appreciate that. So I have a few questions. One of them is regarding something I asked the building commissioner, Frank Oswald, about yesterday regarding mold remediation. You know, his understanding was that it came in, went to the Department of Health. What I heard back from Kevin Bailey in the mayor's office is that it goes to the Department of Health, but then it's moved to the building division.
Yes.
So, you know, where does that fit in with either your work in collaboration with the building division or just in the Department of Health?
So this was a question that, you are right, was posed to me this week. Historically, and I can only speak historically to way before I came here, the process was decentralized from health to building. So I can't speak to why that decision was made and how. What I can tell you is my community sanitation officers are always available for review. They'll come in, they give direct reports. They're centralized now. We can make those available, and they're publicly available too. But as far as why that process is the way it is, I couldn't tell you. It was before my time.
Okay, thank you so much. In terms of further interaction between departments, in the Behavioral Health Bureau, which I know is just kind of getting moving, I do imagine that there's some collaboration between your department and the Department of Human Services regarding unhoused services. Certainly in my ward, that's an issue. We have some encampments, and I'm interested in how outreach happens with them and how much of the Department of Health work is around that.
So it's been very difficult. I think coming out of COVID, every department was stretched, as you know. So even though I'm on the same floor as DHS, we have an open door policy. We've worked together very closely. I would not be honest if I said to you that we get to do a lot of work together, because the rebuilding and the prioritizations of just core services in our individual departments has been challenging enough without trying to prioritize collaborations, which I think on a shaky foundation are just performative. And you know, Alderwoman, that that's not how I do business. So I think for me, it was prioritizing my staff who were burnt out, underpaid, didn't feel valued, a lack of key infrastructure, and very significant fiscal issues is why the priorities are outlined as they are. Once we have that foundation, you can do collaborations. So for example, going into collaboration with another department, maybe you want to do a grant or a contract together. If you've been in the red for audits for 7 years and you're just adding more grants and collaborations and fiscal responsibilities, to me, that's not a wise way to go. So that's why you saw the less flashy, less doesn't get as much attention, focus internally on our fiscal bureau. We were down to 2 people in fiscal bureau. I filled that department. We have Armamino on board. We're working with the mayor's office and Missouri Foundation for Health with simple strategies around grants management. But I think that, I'll be honest with you, that's where the priority has been. Having said that, there is a crisis within a crisis within a crisis, right? We had COVID. Within that, we had behavioral health, we had gun violence, and then the unhoused issue. So we work very closely together, and my hope is that we will see more formal collaborations. Valerie Russell and I are working together right now on a DOH-DHS priority around the elderly and the unhoused to bring them COVID-19 vaccines and get them Medicaid coverage during this period that we're losing federal funding for all of these things, and people don't understand that the most at risk will be in further danger, right? So we are doing some, and then lastly, the new bureau chief, Julie Gary, who we announced in the last monthly report, which I hope has been helpful to the board, us rolling that out for you. She has been in talks with setting up, like I said, this task force. So this task force allows other departments and over, like I said, it's close to 50 active community partners that have had 20 meetings to break down those silos. Those silos are the real challenges as it pertains to collaborating and making sure that there's intersection in work. So that's going to be the big priority. We have built, for the first time, we used to just have public information officers. We're building a bureau. We're onboarding 2 new people within the last 3 weeks right now to really have a campaign strategy. And then my hope is to also then add a dedicated community outreach worker to address Alderwoman Boyd's concerns. Like, where are these people? There isn't a dedicated strategy for how we do community outreach. So you'll see that as well next year.
Great. Regarding how much of, this is moving us a little bit more into the budget-specific questions, but how much of the work that gets done by the health department is done by contractors versus department staff?
That's a great question. I'd just like to see if I can liaise with Emmanuel, who's here. Emmanuel, do we have an estimation of how much of our work is subcontracted versus done by actual staff?
Can you go to the mic?
But if by proportion or by percentage, would that be hard, or can we get that number back to the board? We'll get that to you.
That's great. We're always happy. One of the best things about this committee is we can ask questions that need spreadsheets, and then you can give them to us, and we can look at them in spreadsheet form, which is always very helpful. I had a few questions about CARE too. We got a folder from them in our mailboxes just a few days ago that outlined a potential giant reimagining of the workhouse area, including care and homeless services, and I thought it was really interesting. So I look forward to hearing more about that as it kind of resurfaces as a conversation. Let's see. I think that's everything for me for now. I really appreciate you being here. Thank you so much for all you do.
These are great conversations. It's great to have allies and leaders who care about public health and push us, and the accountability is part of the improvement.
Thank you.
I believe Alderman Aldrich is, no, is it is it Sonia? Sorry, I don't have my seniority list. Alderwoman Sonia.
I think they have us sitting in the
They do,
audience.
yes.
Hello, Dr. Maddie.
Oh.
Nice to see you. First, I can tell that you're prepared. I love your passion. I love your just honesty. And every department, I think, that talks to us talks about the strong need for modernizing our services and the
Right.
reliance on paper and out of date. And I'm learning myself, like it has its challenges when you're coming into something that has so many antiquated processes, but there's so many strong needs of today. So thank you for that. Also, thank you for your monthly newsletter, because that has been super helpful. I read through it every single month that you send it to us. It makes me feel like I know what's going on in public health. It makes me feel like I know how to respond to my constituents when they ask me certain questions, and I can account for what is the city doing in those areas. Thank you for your, abomination of the treatment of trans folks in our community, and saying that on that stage, and holding that right and making that clear. Your prioritization of focus on maternal and mental health, I think that those are spot on and so important for our city. And then questions. So number one, I want to just invite you right now to a town hall. I'm absolutely going to have one.
Yes.
We're going to talk about public health
Write
specifically.
it down.
So there you go.
Want to be in person. It was so non-accessible during COVID. We more than tripled participation numbers on Zoom, but that's not accessible. So I'll come out, child.
Okay, good. And then secondly, I know one of the things I've heard of, I think it was during campaign season still, but there are behavioral health workers that are in libraries or something along those lines. I didn't hear you mention that in your presentation, but I think to Alderwoman Boyd's question about where are these folks, that's one of the first times I started seeing them, and I know that was a recent change. Maybe you could just tell us more about that.
Our public libraries have been such incredible partners for COVID and mental health and beyond. And I think it's so important to understand community engagement is like a topic within itself, like one of the major ones within public health. And so you have to think about trusted spaces. We talk so much about trusted messengers, but trusted spaces are equally as important. And our libraries have been that and have been safe havens for a while. So we will include that in our outreach plan. I'm never going to lie to you just because I'm at a budget presentation, I want to make it look good. That's probably a second or tertiary tier. We're building foundation around, like Alderwoman Boyd was saying, you've never seen Department of Health. People don't even think about us in these conversations because there was no presence. So it's important to establish that presence, establish a good foundation, get people going. It sounds silly, but one of my prioritizations was hiring a secretary and being very clinical with CDC experts around language and public health that's accessible about who answers the phone, who links people to services until I have a thriving bureau of over 50 people. Where do they go? What does that look like on a website, on pamphlets? To me, that's a big priority before we start collaborating with partners. I know you guys want to see action, but I just need everyone to remember it did not exist before July of last year, and that I didn't even get the opportunity to interview these folks until 2 months ago. It's unfortunately slow, but we're getting there. So before I start linking them to those very advanced library-based community services, it's just important to make sure that core work is intact. But I would like to speak to you more about that in the future to make sure that there aren't any blind spots I have as to how we could be working with our libraries and utilizing them. So I would appreciate follow-up.
Okay, great. I would say libraries and schools. They're
Yes.
like our last two public institutions. So I think when we're talking about equity and accessibility, those are places that everybody has access to, and they have to serve everyone.
That's right. And unlike healthcare, hospitals, and government agencies where there is a valid mistrust and distrust, especially in minoritized communities, those are validly safe spaces. So I think you're absolutely right.
Okay, and then I just would like to hear more about, I know you mentioned substance use and mental health, and Also bringing in SLU law to work on legislative, which is kind of a separate thing. But I would just like to hear a little bit more about as far as like mental health, specifically like substance use
Yeah.
and addiction, some of the things perhaps in the pipeline or programming in mind.
With a small but mighty building team, I had to be very specific about what our priorities are. And we know that the opioid crisis was a crisis before COVID, was exacerbated during COVID, and has been even more exacerbated, especially in Black and brown communities. So I started with data. My good friend Dr. Corey Bradley says data is justice, and so you have to have a good bedrock of data within which to know what you're fighting. And so we built our epidemiology bureau from 2 people to 10 now, and we then moved to prioritizing the opioid crisis. So the CDC, I should say MOU because there's no monies being exchanged, but that partnership for 1 year prioritized the overdose to action funding through the CDC. That when I was asked to meet with Dr. Rochelle Walensky a year ago, as the first health department she had ever visited in her tenure, let's just be clear, we then went to her and we asked her for her support, and that is how she came through for us, and the CDC at the national level came through for us. So we have 7 dedicated CDC employees, and that partnership ends at the end of June. We're gonna bring all of those deliverables back to the city at that time, but the priority and the only work they do is around substance abuse. So we started an overdose action task force that I talked to you about. We have got almost 10 interactive maps already up on the website. They are delivering a finalized dashboard for a data dashboard for the opioid crisis specifically, and then they are more broadly going to be helping us with the strategic plan is the last deliverable, with an equity toolkit that I asked for just as an extra to support that. So that's going to be foundation, because the implementation part of it is so important, but it needs to be sustainable. The biggest thing, and the listening tour I did, and all the 50 organizations that have been meeting with us regularly this year have been very positive, but when they give critical feedback, they're like, every couple of years we get a new director, and every couple of years we start again from scratch, and you've done task force and meetings and, you know, announcements all over. So I hope one of my legacy points is that even if I cease to exist tomorrow, that there is enough infrastructure in place that my bureaus, my staff, and our community members, more importantly, are not starting from scratch. So it's that sustainability piece, but the priority and all of that work is around the opioid crisis. Moving to your second question, which was?
A little bit about like the
The
SLU law
policy, yeah.
piece.
So I'm gonna be straight up I came in, 2 weeks after I came in, I had to come up with a pediatric rollout for COVID, and then within a month, the Omicron surge hit. So there was no time to prioritize policy for a while, but that means we have antiquated policy that no longer serves the community from a public health perspective. But even more alarmingly, when priority issues arise, such as what's happening in our LGBTQIA+ community, and such as the overturning of Roe v. Wade, such as marijuana being legalized at the state level, policy hasn't been updated.
Right.
So I did 2 things. The first thing I asked the county for was alignment. So I asked for a monthly meeting with their counterpart then. My counterpart was Dr. Faisal Khan, and our boards meet monthly and have. We have instituted a record close to 10 joint policies. We actually did 2 joint press releases last year because the community was tired of getting conflicting and sometimes not matching advice from the city and the county. I would have leadership from schools saying to me, in the same school, I have some kids who live in the city, some in the county, and some of them have a 14-day quarantine and some of them have a 10-day. So we were able to work together swiftly and have an alignment of policies. I then moved to creating not just having poor Craig, be the sole policy person for the Department of Health in addition to all his other roles, just a formalized structure for how we do policy, both for the city, the region, and at the state level. And so when Casey came, and she has been, many thanks to Mayor Jones, I thank her more times than I can for Casey Milberg. She is phenomenal. So we have Casey housed in the mayor's office. We have a liaison in the city councilor's office who now works with us with intention on all policy work. And then Craig and my commissioner of health, Victoria and Worry, phenomenal, are the sort of the key triad for this process. But I knew capacity was a problem. Often we do this, right? We hire one person, we don't give them budget, they don't have capacity, and they have to do policy for the whole city. So I wanted to bring in public health policy capacity through SLU Law. So I reached out to them. I'd had some partnerships with them and had been doing some education on their campus. And Dr. Michael Sina, who is both a lawyer and a physician, and is one of the leaders for their public health policy section in SLU Law, and us will be announcing an MOU starting this summer to bring graduate level students who are interested in public policy, public health policy specifically, to have an ongoing relationship where we give them where we have capacity needs, starting with, I use this term broadly, like an audit of existing public health legislation to make sure we look at what's antiquated, what needs fixing, what needs updating, and then they bring that back to our team, that triangle I told you about with Casey at the helm, and we try to update. But we're also responding in real time. So I also said, while we thanked the Regional Health Commission for their service with Medicaid, we're also going to be announcing a formal MOU with them to be our basically community liaison leader in the region because of what they serve. Their priorities for Department of Health will be policy, data, and health equity. So they're a formal contractor right now and have been for a couple of months informally for that health equity plan I talked about. So they come in to provide expertise level services. So I'll give you an example. When the anti-trans legislation rolled out, because we built in this infrastructure, I was able to bring LGBTQIA plus leadership to the table. With that team I talked about, we were able to talk in real time, give updates about what was happening at state, and now we're talking about what the mayor is leading through her office as to what our response is going to be from a policy perspective. But because there's infrastructure now and a protocol, this is happening with intention through the Department of Health.
Okay, thank you.
Welcome.
Okay, Alderman Aldrich.
Thank you, Madam Chair and members of the committee. How you doing, Director?
Listen, I shouldn't have worn heels, because you know I'm not a heel girl. This was for fake, so I should have worn flats. But other than that, you guys are being really kind to me, so I'm doing good.
But trust me, I ain't gonna keep you up there too long, because I know we still have to go through the budget process, so we don't have you standing and stuff. But thank you for coming. Thank you and your amazing team. I know just how being able to work with the health department and being able to work with the former alderman who works on your staff, just how incredible and passionate you all are about really saving lives in the city of St. Louis. As you give your speech, you can just hear the passion and the, for people, I think up here and just even that are listening on TV that want to see St. Louis move forward, that passion that we're going to move from a place where we are now to a place that really impacts the lives, generational curses and generational health issues that has been going on, but on top of a pandemic that we, fail to realize that it wasn't just that long ago, and we still are trying to fix some of the problems that the pandemic has brought onto people's lives, especially when you talk about health and you talk about behavioral health and you talk about mental health. So I want to, since we are on live TV, I want to give you your flowers today and for the whole city to understand just how incredible this department has been, especially post-pandemic. I've seen you and your team countless times out in the community. You talk about departments that are doing the work in the neighborhood, boots on the ground. I think y'all got an event coming up here shortly. I want to say maybe in the 7th Ward, but connecting residents to the resources directly, not just sitting behind a desk and not just sitting in the department. The newsletters are wonderful to be able to make sure that people can know who and what is going on, but to actually be out in the community and boots on the ground. I appreciate that about you.
Thank you.
Okay, as I say, do I need to reclaim my time?
Just made a little noise when I moved it. My apologies.
But no, I won't take too long. I just want people to really know just the work that y'all do, and I think you gave an excellent presentation, and for members on this committee and throughout the whole board, definitely need to connect with the department. Y'all have a lot of great things coming down the pipeline. I know I've been able to talk with you about it. I look forward to seeing how this board can support, because this is a office that is transformative and is really going to be critical to the city moving forward. So
I can tell. We're really excited to work with you, and you all have been very kind. You're not going to make me cry with these comments, so we're going to go to the numbers, but I really appreciate it. I am just a representation. It is these city workers. I get embarrassed by how often y'all see me on TV and other avenues. It's the 100 people back down the street who do this work every single day, and they do it with way less than all of us in this room, myself included. So it's their flowers, and I'll take it back to them.
please do.
Thank you.
Thank you so much, Director.
Thank you. I just had a couple of
Yes.
questions just to round us out. You mentioned the health report. Who was doing that work? I was just curious. I know you said that report would be done in June and
Oh,
hopefully
thank you. The
presented.
CDC, yes.
Correct.
So the CDC, the partnership we had was for them to give specific deliverables by the end of the year that they were with us.
The CDC, I'm
The
sorry.
CDC.
Okay. And then would you just make sure that the Board of Aldermen receives a copy when that
Don't you
comes
worry,
out?
you're going to be invited to an event, you're going to get a lot of paperwork, and because y'all asked for it, I want feedback. I can't stand not getting feedback because I want to improve things, but they're going to get you a strategic report, that health equity plan, and links to all the data dashboards and other deliverables, yes.
One thing we deal with a lot is, requests for help with animals or with specific things. It would be really helpful if if you could provide us with kind of who within your department we should contact for various things. I know those roles sometimes change, and that would, so that will avoid us kind of coming directly to you and direct us to the staff that's most
Because of
appropriate.
capacity and because not everyone is as polite and as reasonable with their requests, I have with intention asked that they do come through me.
Okay.
Because I can sustain it and it's my job. We recently did hire a supervisor and Justin continues to be the bureau chief, but what was happening when I first came, if I'm being very honest, Alderwoman Spencer, is they would have a workload for which I know you get a lot of feedback and complaints about the lack of capacity for animal care and control, and with that huge workload would then get, sometimes, I'm not joking, 15 emails from different older people, different people in city departments, and then if they didn't respond on time, they were getting yelled at sometimes. I was really disappointed in the way people think it's okay to talk to me and other city workers on a daily basis, and the toll that that has on their mental health. So I will not anymore allow them to be open to that. So the infrastructure we have is that those requests can come through me, but it also has to be documented in CSB, so that there is documentation and that they're addressed in the proper format. And then I make sure that they attend to it. I always respond to y'all with an update about what's going on as needed. But for now, that has to be the process because unfortunately, not everybody is appropriate in how they deal with city workers.
Okay, that makes sense, and I can see that certainly being an issue, and perhaps it might be helpful just for the board if you want to put that policy out. I think we get a lot of questions, and it's always a little bit confusing, especially for new members of the board who to go to, especially when the policies differ by department.
And Nancy Cross did it last year on behalf of the mayor's office in the city, and we can do it now with this new group and make sure that that is sent out in a way that everybody can accommodate. But I'm happy to get the emails. It builds relationships with you, but more importantly, it protects my staff and builds some order, so.
Sure. Lastly, I just had a couple questions about a couple of items that are near and dear to me, specifically related to my previous ward, but when you talked about health equity. A couple of years ago, Christina Garmendia, who's now with the president's staff, performed a racial equity indicators report, which was a really impressive body of work. And it identified the two biggest disparities in health outcomes as asthma and lead. And those two disparities were most prominent in the former 20th ward. And so I wanted you to just speak briefly about maybe those two health issues and what we might be doing and what we can do as a board to support your work in addressing lead remediation and then air quality specifically as it relates to some of the concerns we've seen recently in Illinois coming over and how we can work with you.
Yeah, I'm so glad you brought that up because these are the areas that just don't get attention, especially coming out of a pandemic. So first, I do want to reassure folks that these are actually core tenets of Department of Health and have been for decades. The only reason why sometimes you're not seeing them loudly talked about is because nobody asks, but also because COVID, right? And then the last really difficult piece is capacity. So when I came in, there was one person over air quality, and then there's a small but mighty team that works on community sanitation to support air quality. Then lead is a core service that the department has been working on. We have about 10 nurses now, and one of them is the longest-standing nurse who is the liaison to schools around lead. We have a dedicated epidemiologist who does all the data, and then we have now a growing team within our family, children's, school, and health section. So the monthly report has metrics that we provide to you around specifically asthma and lead because they've been foundational, but you're right, it's limited. If I had the department the size I should have, which is about 5 times the size, I've done the research and compared to comparable cities, we would do more. But it's so great, you're not the first person. In the last couple of months, I've had a few people. We actually have 4 new Board of Health members, and one of them is really passionate about this. So when you have capacity, I would love to introduce you to Dr. Melissa Tepe, who has now linked me to other leaders in the community to just help to see what more we can do in this. But you are right that this is also a health equity issue that disproportionately impacts people with lower socioeconomic status and Black and brown communities, which is a pattern, as we've heard today. And so I think that the intersection, you will see that embedded. My hope is that, before DEI work would be a separate department with 2 people, but it's not embedded. So we're bringing, number 1, training for the whole department around health equity through this health equity plan. Number 2, this health equity plan will mean that there will be KPIs and metrics around health equity throughout all bureaus, including lead and asthma. And then, like I said, number 3, we have new leadership that's been helping us to really think about where our blind spots are and grow. But I'm going to be very honest with you that I think that was one of the many things that went to the wayside in the pandemic, and that we need to resuscitate with priority.
Thank you for that. With regards to lead, we have a higher lead count than even Flint did at its peak when we were looking at our city's children, and it's so alarming. The pervasiveness of, I would say, dilapidated housing that really contributes to that. It's my understanding right now that most of that work is housed currently in the building division,
Yes.
so the remediation process is through that. But as you mentioned earlier, it's so important to have trusted messengers, and building inspectors are often not the most trusted individuals because they're often coming in and writing violations and doing other things. And so coordinating with the health department and with the Board of Aldermen, who typically we serve as trusted liaisons to our communities, it's an area of much needed trust building. And so I want to offer that we can help with that. It's an area that we have so much needed work, and the outcomes are just so important when you're looking at poisoning and the long-term effects of lead exposure to our city's young children. So
I appreciate the feedback. It's an area we need help, and we need new ideas, people who are champions, and my staff need capacity because this is one of the areas where we haven't been able to hire as easily, et cetera. So Kim is taking notes for me. You will get a follow-up email, and if it's not you, whoever can be a champion for us, we will work with.
Yep.
Thank you.
Absolutely consider me an ally in that work. Now I'd like to turn I know we're running short on time, but I don't see the street department here, so I'd like to go through your budget.
Okay. Can I just preface this by saying that this may move,
Oh, she is, okay.
this may move quicker than you
Sure.
expect because we only got this budget on Friday afternoon, so my team and I are still looking at it. So my bureau chief is here and will answer as many questions, but we received it Friday, so.
Oh, goodness, okay. Well,
caveat.
so one of the things that really jumps out when looking at your budget is that it's very different from last year, and it's actually lower. And I know part of that is because the Office of Violence Prevention has been moved outside of it. So what we want to do here, Dr. Motti, is understand where your budget numbers are and where any gaps might be so that we can advocate for anything that you may need to perform optimally and do the excellent work that you're currently doing and expanding into.
Thank you.
You know, recognizing that the Board of VNA has a short period of time to put together a budget, we just want to make sure that in our due diligence that you have all the resources you need.
Thank you so much. And so, Emmanuel, if you could join me, we can talk you through what we know are some of the areas, if the question as I understand it is where there's clear decreases or substantial changes, and then I can just quickly then round that out with areas for the future. I want to say that Paul Payne every year has a very difficult task, and this year was probably the hardest, so we appreciate his work. But I'm unapologetic about the fact that public health is and must be a priority, because there is documentation to say that there isn't a thriving economy without it. So we look forward to growing that in the future too. Emmanuel, if you'd like to just do some key areas where you saw differences and specifically decreases.
So page,
Do you mind, Emmanuel, identifying yourself?
okay.
Thank
My
you.
name is Emmanuel Kani. I'm the fiscal manager of the Department of Health.
Welcome.
So looking at page 197, I believe it's the same with the page that you have over there, is under the operating plan. That page 197 is a comparison of the actual for FY22, the budget for FY23, and the budget for FY24. So what I observed there, like the director has said, we are still reviewing everything from Friday when we got it to today. We actually need more time to be able to review and then identify all the differences that we are able to find. But this big difference on that page, 197, under grants and other funds, we have total of 60.5 employees for FY23, and it's down to 39.4.
Right.
With a difference of 21. So even if the supportive reentry was taken out, that was 12 employees, but this is down by 21. So I'm still trying to find out why we have that big difference.
Okay.
So I don't know what the answer is right now. I need to review for that and get with the budget division.
Okay, so I think actually in the interest of time, and so you have the appropriate opportunity to go through the budget and understand it. What I'd like to propose is that we come back once you've had the opportunity to go through that, so that we can go through these numbers. They are so different
Yes.
than last year. So we just really want to do our due diligence in making sure that they reflect exactly what you need, and where we can speak to them with good grounding.
And Alderman, what would be helpful is a small summary that we can email to you prior to that, or will you just let us know of a date and time? What would be the most helpful?
I think what we'll do is just kind of work with our staff to find a time and date in the next week.
Okay.
Next week that would work for you. We'll fit you in. We're currently meeting daily between 9:30 and 1:30.
Yes, we will make ourselves available. Thank you for your service. That's a really tough schedule, but that will give me and my staff, and I appreciate the consideration, more time. We have some answers for you, but we would love to give you something that's thoughtful and considerate, and we can, we will reach out to you by end of day Thursday to schedule that if that works, but Emmanuel will prioritize that for this week.
Excellent. Thank you so much.
Thank
Yep.
you.
All right.
Any other questions for me?
Any other questions? Nope. Thank you so much.
Thank
We really
you.
appreciate you. Thank you for taking our flowers back to your department. Thank
I
you.
will.
And with that, we will move on to the Streets Department. I believe our director is in the hallway, perhaps? Do we know? Okay, thanks, Shane. All right, now we are moving on to the Streets Department budget. Director Williams, if you don't mind, so I've been kind of reminding folks that we are here in person, but we're also recording and we have folks at home. So be sure to speak into the microphone and identify yourself and anybody who's going to come up from your team to discuss the budget today. And welcome.
Thank you so much. My name is Bethany Williams, Director of Streets for the City of St. Louis, and I have our commissioners, Commissioners of Streets, Kent Flake, Commissioner of Traffic, Jamie Wilson, as well as our Deputy Commissioner of Refuse, Randy Breitenfeld. I have copies of our PowerPoint that we have available. I wasn't for sure if we would have the technology, so I made copies to share with you all, which gives a high overview of the top 3 budget change items for the Streets Department, but I am willing to go through as much as and answer any questions that you have.
Director.
So what you see here on the first slide, or the second slide of the PowerPoint, I kind of wanted to give an overview of some of the action items that we are working on with the Streets Department. Question? Oh, okay.
Yeah, I was just going to say, if you want to start out and just kind of let us know what all is under streets, and just kind of give us an overview, because I think it's your purview is a little wider than we might anticipate.
Got you. So the Streets Department encompasses a couple different divisions. 1, street maintenance. 2, the Director's Office, which handles all of our city permits for street festivals, things of that nature. That's where our 50/50 sidewalk program is housed, as well as our sewer lateral program is housed out of the Director's Office. Then you move to 511, which is our traffic division, which that handles all of our signals, all of our timing of signals, anything traffic related, speed humps, all of that pretty much falls under Jamie. Then you have street maintenance, which handles all of your potholes, all of your pavement analysis, the paving that we're seeing done this summer, snowplow removal, as well as street sweeping and cleaning is under the street maintenance division. City tow, which we really don't have a lot of changes in the budget for the towing division, but that's where they have our weekly auction that we have for the City of St. Louis for vehicles that have been towed. They tow vehicles at the COPS request, as well as derelict vehicles in the city. Once they've been properly tagged and residents have been informed, then we tow vehicles under the towing division. Lastly, we have the refuse division, which handles all of our recycling services. They handle all of our trash collection service, as well as our bulk pickup in neighborhoods and from our buildings as well. So that is a summary of the Streets Department. On the first slide here, you can see some of the things that we are working on and some of our key priorities for this summer, paving being one of the main ones. Everyone knows, everyone is looking forward to how do we pave, how do we improve. We have come up with a top 10 list, or really not top 10, but as projects are coming available, we are adding them to that list, and we are prepared to share that information if it's asked for. On yesterday, I had a meeting with our GIS specialists to update some of our maps that we have currently on the website, internal use as well as external use, that will show some of this paving that we are doing and starting to move forward with this summer. Street cleaning, because of our staffing issues, we're starting to beef up our staffing. We're getting more employees in the door than ever before. And so because of that, we're able to get back on schedule with our routine work that we're doing, as well as cleaning on schedule, the street cleaning that is posted in neighborhoods and residents around the city. Derelict vehicles. We have a number of derelict vehicles across the city, so I've asked the city toll to come up with a plan. One, identify how many derelict vehicles we have and where are we in the process. Have they been tagged once? Have they not been tagged? So that we can remove as many derelict vehicles off the streets as possible. One thing we do have with that is the capacity of city toll. The toll lot is at capacity. That's why it's important that we have an auction every single week, so that if I move out 60 cars, at least I have space to bring 60 in. So that's why the auction is so important. And you may hear or people talk about, you know, as soon as my car was up, you know, they put it on the auction, and that's because we're just trying to use the capacity so we can facilitate the needs of the city out in the streets. We're also working on trash pickup, making sure that it's a more regular service than it's ever been, where we have been in the past 2 years because of staffing shortages. We have brought in additional maintenance crews to work on our fleet at night that makes our fleet more healthier than ever before, as well as we are in the process of hiring more drivers and training them so that they can go out and facilitate some of these routes that we, on average, have 55 routes a day that we are facilitating. And so at our lowest point, we may have had 20 drivers for 55 routes a day. And so when I say a day, that's Monday, Tuesday, Wednesday, Thursday, Friday. So, and we're working 7 days a week to catch up on a weekly basis and pick up as much of the trash as we can. And then our striping. We did a campaign last month where we enhanced as much of the bike lane striping across the city as possible. The mayor's office gave us a dedicated list, and we went out and striped as much of that as possible, as well as we're in the process of striping crosswalks, as well as pavement markings across the city as well. I don't want to spend too much time on Board Bill 184 and Board Bill 120, but if you all have any questions about those, please feel free to ask those questions to myself or any of the commissioners or deputy commissioners that are here, and we will address those questions. Moving into the FY24 budget. First, you have 510. I'm going to talk about 2 departments here, and then I'm going to allow each of these gentlemen to come up and express their feelings or their requests that they've had, as well as their top 3 for each of their divisions. So when I look at, I know that one of the questions at hand here is our sewer lateral program. A lot of you all may have been copied on an email about the sewer lateral program and how we do that business. It is a work in progress. We are continuously trying to figure out how much are we spending on an annual basis, because our city and the plumbing system, as well as our drainage, is causing major problems now. We're seeing major breakdowns. And so we know that where in the past it's been okay to just say, we will move forward, or we will commit these dollars from the next year's budget, and our contractors have been working with us, and now we're seeing that that's starting to be a problem. And so we are addressing that to figure out how do we make sure we commit the dollars or move around dollars or allocate more spending for the sewer lateral program. One of the first and main things of the 510 budget is, you know, we've asked for Deputy Streets Director. This person will assist us with some of the special projects that we have, you know, overseeing the ARPA dollars that we have, making sure the paperwork side and documentation side of all of that is correct, as well as any other special projects and changes to the department that we're making. So we're currently sending RFPs out for smaller business owners to contract out some of this work. The mayor's office constantly gives us ideas of how we can move forward, as well as how to spend these ARPA dollars. And this person will assist me as the director in managing those tasks and making sure that those applications are in on time and they're being completed, and any grants or things of that nature that we can apply for as a department, they will be responsible for those. I talked about the sewer lateral, and another thing that we have, since we had our flood almost a year now of the building, we are seeing that some changes that we had to make in emergency cases are helping us be more proactive in our dealings and safety of our employees. So where we had telecommunicators that were assigned to traffic and telecommunicators that were assigned to city tow are now coming under the 510 umbrella, and they will be streets and traffic telecommunicators. So they will not just dispatch one duty or, just call outs for on-call or police knockdowns of signals. One dispatcher will be able to handle all of this. So if it's for the tow lot or for our traffic division, all of our communicators will be housed now under the 510 umbrella moving forward with this budget. And the last change I want to talk about, 513, which is city tow. You really won't see many changes to that budget because last year we put in for additional funds to make improvements on the grounds and make improvements to the facility, and we're just continuing those. So looking at enhancing the camera system, enhancing the lighting system, enhancing the safety of the building. We put a fixed roof on the building where we were seeing problems with rodents and things of that nature in the building. So we're just planning out the budget, how we can bring this property up to standards, so until we can find a new location, a larger location for that property. Next, I am going to turn it over, if you have no questions about 510 or 513, which those are pretty, yes.
I have questions about 513.
Okay.
Because I think, thank you, Director, towing, the sheer volume of derelict vehicles throughout our city is just so enormous. I emailed, not to speak about specific board things, but I did email your street director yesterday. We paved around a derelict vehicle in an alley the other day, just because they're so everywhere. And what is alarming to me is the reduction in budget for city tow, as well as the reduction in staffing for towing in the 513 budget item. So I see 513 budget going from 2.5 million budget fiscal year 2023 to 2.2 in fiscal year 2024, and staffing going from 29 to 26, and I'd like you to speak on that.
So you can see what we asked for in the budget, and so that's what was proposed. And then,
I'm sorry, Director, where can we see where you asked for? I'm looking at page 123 in the operating plan, but if I'm looking
so
at...
if you look at, not to cut you off, sorry. If you look at page 238.
Okay. Okay, 238.
So here you can see where the Commissioner of Tow, the salary was cut, where we requested the requests for, we requested the same budget of $78, but it was cut to $64,844. So that's a deduction there. We actually increased the number of tow drivers, tow truck operators from 12 to 14, and so we were given that. That's one of the changes. Let's see.
I mean, one of the things that, in doing some due diligence last budget cycle and looking at the tow division, I believe it was every dollar we gave the tow division, there was a return to the general fund of about $1.20. So this is a department that not only helps clean up our streets and remove the derelict vehicles, also helps us solve crimes when you're looking at stolen vehicles, because the quicker we can get to a vehicle, the faster we can get it back to its owner. And it returns revenue to the city. It's such an important function. And I truly hate to see, for all those reasons stated, the budget for tow reduced from last year. We have a serious need to remove these vehicles off our streets.
So what I can go back and do is look at the budget, because to identify, because I do see a change, and I know for a fact that the towing commissioner, we asked for 78,000, and it's 64,000. So if you give me opportunity to go back and cross-check this budget and see where that other, I think it's almost 200,000 that it's reduced from what we used last year, I can provide that information for you in an email.
Thank you, Director. And then also, I'd like to see that what, on the staffing side, when I look at budget fiscal year '23, seeing 29 staff members going to 26, I know some of our tow truck drivers, they do an excellent job, and they work their tails off, and they're very responsive with what little we have. I also am curious about the equipment that the tow department has, and I'm talking about vehicles, and I'm also talking about storage space. So what is it who is the current commissioner for City Tow?
So we don't have a commissioner. We've just got a list with 2 additional people to add or to interview for that job. So I will start interviews next week for possibly having a commissioner of tow. But right now, our supervisor is Edwin Young, that is managing that property and the functions out of that building at this time.
And Mr. Young does an excellent job, I have to say, with what he's got. And I know former Alderman Chris Carter's jumped in and is helping out in a significant way.
Yes, I've asked him to jump in and help me with, just knowing what's on the property, inventory, how do we optimize our space that we have there if we can't find another space, making some of those boots on the ground, helping me with safety improvements, finding contractors to help do that work, starting that process for me where I just don't have that dedicated time to dedicate what a commissioner would do if they were in that spot. So that is why I've asked Mr. Carter to step in and help with some of those things. And I will say also that you see the decrease in the number of employees at the tow lot is because the telecommunicators have been moved to the 510 budget as well.
Okay, can you just, tell the telecommunicators, how many of those have been moved?
4, so it's 4 from tow, and then I think I have 4 from traffic. Hold on.
Okay,
4 from traffic, so a total of 8
total of 8
are being moved to the 510 budget.
to the 510 budget. Okay, but the 510 budget only went up by 5 from last year, by 6 from last year. You go from 17.9 to 23.9. I don't know who that .9 is, but I guess they're a small person.
It could be that we are.
Could be Carter.
Don't.
He's
don't
out of
do
town.
that.
He just know.
Have in the director's office where they added 4 telecommunicators to the budget.
Okay.
So let me look at that and see where those other 4 went, because he took them away from 2 locations.
And Director, we just want to make, I know that, these departments get a lot of requests, ton of requests. It's too many to even begin to quantify, I'm sure, but, we just want to make sure that you have what you need. And through this budget process, we're identifying, where we need to focus our dollars and where we need to make sure that, if we're going to come to you during the year and demand that you, provide these services, that you have what you need. So, again, for the tow, I've done this every year. It's an area of real serious importance for me personally as an alderperson and somebody who deals with a lot of stolen, derelict, and abandoned vehicles. And I have a lot of requests for that department. So, the vehicle, the towing equipment, the space, do we have adequate space up there at the tow lot? I know we get full a lot, and so, that is a problem, when we have drivers and vehicles out there that can't pick up a vehicle because we got literally know where to put it.
Right.
For a city that has an enormous amount of vacant land, that we need to make sure you have the secured space you need to tow these vehicles to.
Right.
So,
So I will say that through the LUSTAT program, that was one of my top things that I brought up was space. You know, with all the services, the city treasurer's office wants to start booting vehicles again. We're looking at revenue generators for the city that we're not able to provide that service on the back end because of spacing. So we are looking currently for additional space. We just haven't been able, you know, we found like 2 properties and then something else. They had plans for another building or was sold to someone else. And so we're just continuously looking for property that we can move to that will give us more space, as well as some of the changes on the lot. You know, if we pave the lot and I put pavement markings down, maybe that will help, you know, control spacing some instead of just parking where you see an open space. So maximizing the space that we have is what we're trying to currently do now.
okay. In the current budget that you have, do you have funding to be able to expand the physical space at the tow lot if you were to find an adequate location?
No, it's not there because, go ahead.
Okay, because, so can you quantify, what I'd like to do is put in, for this committee to understand what the tow department would need to function optimally, and that means expanded space, you know, and the equipment, the trucks, et cetera, and the manpower that you need, and a salary that would attract a high talent to run that department. This, for those new down here, this department has had a lot of issues over the years. We've been sued, we've had corruption and other things, and we want to make sure that that never happens again, and that we're able to attract the talent that can ensure that this department can be run well.
So as well as I will say that we're currently at the bargaining table with the union for the drivers, looking at their salaries, how do we increase? I have not seen word back if they accepted the proposal that was presented, but putting more of a 5, 10, 15 year, as well as increasing the starting salary for the drivers. We are seeing more drivers coming in now than we ever had before. So it's starting to look promising, you know, that we can get this work done. But I understand your question, and I definitely will get that information for you and share it.
Okay, thank you. I'd like to, so Director, you had gone through your 510 and 513. Do we have, I'd like to turn it over to members of the committee if there are questions about those 2 budgets. Alderwoman Boyd? Okay, Alderwoman Schweitzer?
I'm definitely interested in hearing more about the sewer lateral program, but I guess that's a different fund, so I'll wait. I do have to head out at 11:20 would be ideal. So should I ask questions now or just send them an email afterwards?
You mean about, if you have questions sure, go ahead, Alderwoman.
Sure. So would it be possible to hear a little bit more about the sewer lateral program? I have a lot of folks who reach out about that in my ward.
So we have, so I did ask for rough numbers of our spending of the sewer lateral. Currently, we have about $84,000 left in the budget this year, and we've already allocated about $460,000 for FY24 budget. And how that works over the past years, and Kent maybe can elaborate a little more on it, but you know, we have contractors, the same contractors that do the work. They bid on the work, and then they understand that, you know, we are committed to these dollars once the FY24 budget, in this case, comes available, and then we will pay them out for those services that they are doing for us. So the service never stops. It's just making sure when the new budget becomes available and we pay them out. We are seeing an increase in the number of sewer lateral requests, and we're getting to them as fast as we can.
Sure. So in the budget, you put in as many routine requests as possible in that routine list. And how far between when the request comes in and when the work is done, how long is that?
So it could take a couple weeks, but depending on the
routine
contractors.
list or if it's on the emergency list?
So the routes, I don't know that it's a difference in the
Big difference.
routine, or how long does it take emergencies?
Good morning.
Good morning. My meeting's with you at 11:30. I have a feeling you might miss it.
Yeah, we can just move that back a couple
Okay.
hours. So yeah, we have a routine list, which is for, first of all, I'm Kent Flake, Commissioner of Streets.
Hi.
Second of all, we have a routine list, which is lines that are damaged but are not causing either backup or hazards in the right-of-way, so cave-ins or giant holes. The routine list could have a wait list essentially forever. Anytime we do have a job that is an emergency job with backup or that is causing a cave-in in either a street, alley, tree lawn, those are almost always completed within 30 days.
Right.
Closer to 14 to 21 days.
Okay. Okay. So the 460 allocated, is that all for emergency?
The 460 that's over allocated, I guess, for lack of a better term. Yes, those are all emergencies.
So there's $0 allocated for routine maintenance this time?
That's correct.
Okay. That sounds concerning to me. It sounds like it's probably concerning to you. Okay. Yes, you don't. I'm sure I'll have so much opportunity to ask you all more questions in the Public Infrastructure and Utilities Committee.
Right.
So the other piece you mentioned in talking about having contractors do this work, at the board, we've gotten a lot of emails from people who are contractors who say that they have issues getting, paid in a timely way. It's not always one department or another, but it does seem to be a citywide issue. In the streets department in particular, how does the process of paying contractors work? I know Oracle, they're supposed to input the contract and then input the invoice, and that's when the comptroller issues payment. Do you find, how long, what is the process in streets? Is there one person who is over that?
So we have a supervisor that once the work is awarded, the contract is awarded, the work is complete, then they process the paperwork for payment. So that's really a two-man show, the supervisor and then the accounting clerk in the department that handles processing the payment to the comptroller's office.
Okay. And how long does that process normally take? And when does it start?
I would say it takes about a week or so on our end. Normally, as soon as the work is done, I see the emails that come in processing the payments. So I know that the staff is doing their part to get the payment out. It's just, we get calls, and when I get calls from contractors saying, I've completed the work, where's my payment? I can easily go back to those emails and see that we've processed on our end. We're just waiting on the payments to be made to the contractor, which that part is out of our control.
That's really fascinating. I think one of the things that just comes up during these budget hearings is the different perspectives of what's going on. And I think what keeps coming back to me is the communication. What is being broken, what is happening or not happening, and how do we, is there a budgetary fix to it? That's one of the things I think we're tasked with on our committee. I
think with
Go ahead.
Oracle, the new system, I think we're just all learning it as a city right now. And it is my hope that once we all have learned the system and everyone's totally comfortable, these errors or long waits that we're seeing won't happen in the future.
Sure.
That's what my hope is.
And you feel, has the training on Oracle been adequate to allow your staff to do the work in a timely manner?
I know that we've had training. It has been high level for some employees that are doing this work that may not be used to technology and new way outside of paper of doing business. Right. And it's just taking more time and more training. Currently, I have my payroll specialist that's in training now. She came from a department that she had this background, but it's just like totally different, and so she's in training. Now, again, making sure that she understands the ins and outs of Oracle and the paying system that we have.
Okay, thank you. Thank you so much. I really look forward to a lot more discussions on everything. Thanks, Chairwoman Spencer.
Sure. Alderwoman Saunier?
Thank you for coming.
Problem.
Okay, I'll be quick as well since we're nearing our time. I had a question about reflector paint. I hear a lot, like, we don't have that much in our streets. I get a lot of concerns, even me, when I'm driving down the street. It's a little difficult, so I'm just curious, are we considering putting that in our toolbox?
So Jamie Wilson, our commissioner, can speak more to you about types of paint that we're using that falls under the traffic division. I won't steal his thunder.
So sorry, just to circle back, we're looking at the 510, the Director of Streets, and then
Director's office.
513, the tow. And then are we going to then go into the other
Yes.
departments? Okay.
So next up is Jamie Wilson with the traffic division.
Great, thank you.
Segue. Madam Chairwoman, members of the committee, thanks for having us here. I'm Jamie Wilson, Commissioner of Traffic for the Traffic Division. For those that aren't familiar, our charge of the division is the maintenance and operation of traffic signals, streetlights, signing, striping, and some general traffic engineering for the city. Our budget modestly increased about 4%. Not too much, but there were some key points to point out to you guys in terms of changes from fiscal '23. One of which is and I'll make sure you guys are on the right page, 233, I believe, is that what it reflects in your book as well? The 511, 1,000 general fund for traffic and lighting division? Make sure we're all on the same page.
33, we've got traffic and lighting.
Okay. I'll wait till everybody finds it.
33, and then that, we're still on 123 on the operating plan. Which actually has your staffing going down slightly from 77 to 75, but your budget
Yep.
going up slightly.
That's just where I was going to lead off. Our first change, notable change, is on our personal services section. As you noted, the positions, we previously had 77 in our table of organization, and now we're at 75. That is the product of 77 positions minus 4 positions, which the director noted were the 4 telecommunicators or dispatchers. So 77 minus 4 is 73. And then the notable changes, we're adding 2 painters. And that is to afford ourselves the ability to stay with our mainline operations. As we currently run, we've got 5 painters for the entire city. When it comes to doing handwork such as stop bars, crosswalks, that type of stuff, we have to take guys off of that, and we don't have enough to run our liner truck and the backup trucks and all the supporting personnel to do mainline striping, for example. So it kind of derails one operation to get the other one going. So my proposal was that we get 2 new painters. They're dedicated to just handwork. They don't see mainline operations. They stay on stop bars, crosswalks, bike lane stencils, that type of stuff, so that we can keep on the main line so our mainline striping looks better, while at the same time providing the type of pedestrian and vehicle and bicycle lane markings that we should have as a city. So ideally, I would have 100 guys doing this, but we're going to start in a modest way, adding 2 more, see what the impact is, and seeing if it's something we need to keep feeding in future fiscal years. But so that is the change. 77 minus 4 dispatchers plus 2 painters equals 75 positions in the city in the painter section. Our next notable change is in our account 521511, and that's traffic poles and bases. These are some pretty boring accounts to go over here, but these are notable changes. As I said, we're in charge of the maintenance of streetlights and traffic signals, so this account addresses that. Partially, it's broken into some other accounts too, but this one is centered on the traffic poles, traffic signal poles, and the streetlight poles. and some of our signal bases as well. So every year, unfortunately, we have about 500 streetlights get knocked down, and you could graph that out historically for 20 years, and it's about 500 every single year. We have 55,000 lights, so that is, while a small percentage, it still is a large amount of streetlight poles to put up every year. So that about encompasses 500,000 annually in just streetlight poles, not even the lights that go on them, just the poles. In previous years, our budget was closer to 500,000, so we didn't have as much money for the other things in this account, such as traffic signal poles and traffic bases. In working with Paul's group in the budget division, went through some very diligent efforts here to get to where we are in years of building up the supporting information to fund these different accounts appropriately, and very thankful that this year we do have 585,000, which will afford us the annual, sadly, $500,000 for traffic signal or streetlight poles, but also enough to cover the other things that were in this account that previously we weren't able to afford because we're just buying the streetlight poles. So that gives us 20,000 for the signal poles and 65,000 for the traffic signal bases, in addition to the 500,000 for the streetlight poles. So that's a plus of 85,000 from fiscal '23. The third notable change from fiscal '23 is in our traffic wire and lamps. Predominantly, this is our wire account for streetlights and traffic signals. Since COVID, we've seen about 150% increase in wire cost, which the first year was about 110%. So this year, thankfully, isn't another 110%, but that first year after COVID just completely knocked us out. We had to not only spend this account, but do transfers from other accounts just to be able to afford the normal amount of signal wire and streetlight wire. So every time a signal goes down, every time a streetlight pole goes down, they got to be rewired. This is the account to fund those type of purchases. So now we're at a point where we can afford to buy that. And again, I say thankfully it's not up another 100% like it was in previous years, but we're tracking that cost right now. So now we have 630,000 in this account, and that's an increase of 180,000 from fiscal '23. So those are our two material accounts of note, and then our personnel account, which I would call the top three notable accounts in the traffic division. That's about, without going line by line, I'm available for any question on the different line items if you guys choose.
Thank you, Jamie. All right, so again, this is just traffic and lighting. I'll turn it over to the committee for questions. Alderwoman Boyd.
Well, since I got skipped twice
What'd you get skipped on?
on everything, but anyway, I'm not calling, I'm asking a question, and it's a general question in regards to streets and communication, because the only one that communicates well is Randy. Nobody else communicates. You have to constantly do emails. You have to keep texting. You keep doing it, and people say, "Well, just call," but nobody responds but Randy. So I'm just putting that on record. But in regards to the lights, how do you justify where you replace lights? Is it a map? Is it per request? I mean, how is that done?
As far as lights going out, we repair.
Replacing street lights. So is it per CSB request? Is it per automatic request? Is it per a map you all have? Is it somebody that rides through the city and say, okay, this light is knocked down, we need to replace it? How is that done?
It is complaint driven through Citizen Service Bureau for the replacement of lights that are out.
Okay, and so when you get those list of lightings that needs to be replaced, how do you prioritize who you go to, what area you attract, or what area you repair? You know, how do you go about that?
We go with the oldest one received gets the first. So like a seniority list, if it came in, the longest reported incident would get addressed first, unless there's something crazy wrong with it where it's on a bridge, we'd have to rebuild the bridge or repair it. It should be the oldest one received is the first one that gets attention for replacement.
Okay, because as I previously rode in the 27th, it was lights that were knocked down. And it's not to your fault they were knocked down because of the reckless driving, but when I'm seeing the cones on the broken lights, that's telling me you all are aware that this light is down. Am I correct?
That's correct.
Okay, and so as I have acquired a larger ward, I'm seeing more cones on street lights, and so that's why the question is brought to you. How do you, okay, if you got the cones there, that's telling me you all are aware. But when I see these cones sitting from 6 months to a year, so apparently it's not a priority or it's not on the list and you all just put the cone there and nobody followed up. Am I on point or where am I?
No, we currently have about 250 knockdowns right now, which is what you're seeing, the cones on top of them. And those are still the list we're working off of fixing. So we have 250 open service requests right now for fixing knockdown streetlight poles. That's why I said every year we have 500. So right now we're at 250.
I'm just trying to
Open, sorry.
Okay, I'm just trying to get visually in my head. So if you have 250, I know you have a map or something that's telling you where these lights are down. So are you targeting an area to get those lights up, then go to another area to get those lights up? How are you mapping out how to, and I heard you say earlier, the oldest, but how are you mapping out to say, okay, we'll cover this part of the city to get these lights up, then we'll replace these lights in this part of the city? How are we doing that?
Generally, it's the oldest, but they also do carry additional poles. They have the ability to go back if they see one that's an adjacent pole is down. Perhaps for efficiency of the trip, they would fix that one as well right next to it. But we start getting too far off track, then we start logging miles that we just stay off track. So we try to stick to the plan, but I don't believe we've ever tried gridding out an area and just attacking it all and ignoring the seniority of when the complaints are received.
Right, and so that's
I'd be breaking one thing and fixing another. That's
right, and that's the issue. And so I know it's an ongoing issue because as soon as you fix one, then another one will get knocked down by a car for whatever reason, and I get that. But I guess my concern is when I'm seeing the cones on there, that's letting me know you're aware of it.
Yeah.
And when it sits 6 months to a year, that's a concern to me.
Yeah, we actually, a year and a half ago, had those knockdowns down to under 50, which was great, which was historically a high score for us to be at that point. And then we had delays on receiving poles, the poles being shipped to us, and then we got back in the hole. So now we're trying to climb as far out of it as we can.
Okay, so that's the same for signal lights also? Like
As far
traffic
as-
lights, that's the same for traffic lights also?
Yeah, you'll see barrels or the area's been made safe if a traffic signal is down as well.
Okay, so if it's a construction, and I know everywhere else I see, when it's a construction being done, you all have plenty of signage to say detour, road closed, whatever. So does that go up as soon as the construction is started? So the pedestrians or the drivers will know that they have to detour, or how is that done?
Generally, we don't have major construction projects where we run traffic division-led detours. Projects that are contracted out, for example, through the Board of Public Service, maybe working on a signal and have associated detour signage with it. Not something typical you see from us. Our work is fairly isolated. We're just maintenance, not any sort of capital improvement-led effort. So if there's a knockdown, you'll see us out putting a mast arm back up, but you won't generally see us taking any signal or number of signals down that would require a detour that we would sign for.
Okay,
So that's
no,
probably
not signals. I'm just, so I'm talking about, like, if it's construction or something happening, would you all play a part in that, putting signage up?
No, that would be
Okay.
usually through
That
their,
person is doing the
through their permit,
construction.
they would have, be responsible for a traffic control plan associated with the work that they were permitted to do in right-of-way.
Okay,
Yeah.
all right, thank you.
So, Director, just to be clear, with the Alderwoman's questions, you know, we kind of going down the same path, 250 poles down with 500 on an annual basis. That projects to me about a 6-month wait period from the time in which you become aware of the pole being down and us being able to fix it. That's a really long time for a traffic signal to be out of working order. And
Not the traffic, that's the
Street light.
or, excuse me, the street light, yeah, and the
Same
traffic,
thing,
yeah,
both of
right.
them.
Do you, does this budget reflect what you need to get that down to 10? Or, you know, a more reasonable amount, you know?
No, it doesn't. I guess to jump ahead to what would be the answer to that, I guess, is either we have more staff and more poles internal to do that,
Okay,
or it's something that would have to get contracted out, where the contractor would be responsible for not only the labor to repair it, but also the pole.
okay. I mean, I think, you know, having poles on hand, I mean, having to wait for poles coming in is a really unfortunate place for a city that has kind of a universal pole.
And actually, I will
mean,
note.
there are different ones, I understand.
That was the, whatever, the post-COVID delay
sure,
thing.
sure.
We've never had that issue with
Okay.
street poles, so I don't want to blame the vendor for that one. That was like a one-off, so, but once it happened, that's when we got in the hole, because as I said, this stuff happens monthly, daily, so that got us in the hole. But historically, that delivery is not an issue.
Okay.
But just that one time it was.
But to Alderwoman Boyd's point, I mean, you know, having 250 down, a 6-month delay and getting them fixed, seeing a cone there on your street for 6 months is just, that's not a.
Excruciating. Yep.
Right, it is. So let's figure out what you need to make sure that we can get those repaired in a reasonable manner, that you have the tools.
And
So-
I think my frustration is beside the cones, because the streets, I know you all don't have half the equipment you need to have, because it's all over the city laying on the ground. Between the detour signs, the lane closures, I mean, it's just cones, it's just stuff everywhere. And I just think that's just such a waste. And so, again, if we have those cones there, that's telling me, okay, we know this is out. So if it's something you all need in the budget to say, we need to increase to buy poles or whatever, I just think that's embarrassing for us as a city, because it just looks like we don't care. And I'm just gonna be public, it's certain areas that you don't care more than other areas, because I see the cones more in certain areas than in other areas. So when I ride the city as a whole, and I don't see that in certain parts of the city. In certain parts, I see a lot of it, and it's like a norm, and I don't think that's okay with me. So if you can come up with a solution, I would appreciate it.
Okay.
You. Alderwoman Saunier, traffic and lighting.
I think I just, similar concerns and questions as Alderwoman Boyd, so I don't really need to repeat in anything that's been said. I'm just very curious in, you know, if it's staffing, if it's capacity, you know, whatever might be needed to increase that.
I mean, ideally, we'd have people apply for those positions that we have vacant. I don't know what at this snapshot in time, I think it says we were 22 employees short of a 77. So that's, I don't know, approximately 30% vacancy. If we could find a way to attract more folks to apply, that would be in the form of utility workers, trades helpers, electricians. That goes directly to what the traffic division does. And I know there's been talk of some salary discussions with the unions and the trades. So any improvements in that area would be welcome.
Well,
The traffic
Jamie, you
division,
know-
that's our bread and butter, are those employees I just mentioned. They're the ones that directly go to what I said before at the opening, the maintenance of the streetlights and traffic signals and paint and signs. That's the folks that do that.
That's a huge hole to fill. So given that, there's a particular skill set, if you could maybe talk to some of the folks that have recently filled those positions and ask their experience with, kind of the process of how they found out about the job and any areas to improve how we're getting the word out and getting folks applying to you, we would be happy to help, at least advocate, recognizing that this is, a certain set of skills required.
I just saw this, I probably should have noted this on this subject. I really didn't think about it till out of all the items, but we did consider as part of a plan, an idea we work 24/7, so we have a second and third shift that operate overnight after the traditional workday, and we have folks that work in that. One of our ideas was perhaps to bring the second and third shifts, people that are actually working for us, to the day shift to more augment our daily workforce to get some of these things down, like knockdowns, streetlight pole knockdowns and such, and then potentially farm out or contract out our second and third shift coverage. And our second and third shift coverage exists predominantly to address emergencies, and those emergencies are streetlight poles that get knocked down or lay in the middle of the street, if traffic something gets knocked down and laid in the middle of the street, emergency locates, that type of stuff, which happens frequently enough to make it a requirement that someone covers that. So that was something we considered, and I know there's competing demands obviously in the city, but that was in the form of, I think, our professional services account, the 566000 account. I originally proposed a pretty hefty $950,000 to do something of that sort, to bring that second and third shift people that actually work at the city already to the day shift, add to our day shift where you're a lot more productive, and that's when they would put up the streetlight poles. They're not putting up streetlight poles in the middle of the night when the circuit's active. So bringing those people to the day to augment those forces to try to catch up on this stuff.
Okay, we do need to hear what is going to make you operate most optimally. And, with regards to the nighttime number, when lights go out, when your block or a block goes out, we need residents to be able to get directly a hold. And right now, I'm unaware of a way to do that. You got to call a number, and then then we hear the director's voice giving us another number. You got to write that down. It's very complicated. And so we used to have a direct number we could call 24/7. So we need to get that up and running again so we can give people a way to easily, because when lights go down on a block, it's inviting crime, criminal activity. It's scary for residents. It's really hard to get out of your car at night, and it happens very frequently. We need to be able to address it. 911?
You can't get through.
We can't get through to 911. I don't encourage.
Right, you can't get through.
No, yeah.
That's, with our flood, that's the reason why the regular number is not operating at this time. It's no number to operate. Everything was flooded out. We have a completely new system that's being put into our building. So the numbers that you have there is either, you can contact CSB, you can contact 911, or we have our dispatchers at the tow lot, which are the people that you would call at night to say, my service is out, or my block is out, or the police department will transition to us that there is an emergency knockdown. So we've done the best we can because of our current condition and not having our building up and operating at this current time with the flood.
Okay. And that is, you guys have withstood an enormous calamity with the flooding, no doubt about it. But I do want to discourage people from using 911 for non-emergency purposes right now, given the horrifying state of 911. I mean, 50% of all calls are being delayed. So with that, we want to make sure you have what you need to get a phone number working that is not going to add to the 911 call volume. tell us what you need, and we're going to advocate for you to have a phone number. You don't have to tell us right now, but what we would really like to make sure that we have a dedicated number for these streetlights like we've always had, that we're not pushing people into a already overtaxed 911 system, and that we can get a way for residents to report those, especially at night. It is a public safety issue, and I understand why 911 is a backup, but I can't, under my conscience, recommend that, just given the
And they
state of
don't have
911.
a non-emergency number.
Yeah,
Because
so,
if you call non-emergency, it sends you to
It won't-
the police station. And so it's like the chair said, it's just too cumbersome for residents. We had a number, you hit number 3 and you got somebody. And so we just need to get back to that so those residents can call, because there's some areas, there's no way they can survive with no street lights on.
yeah, yeah, it's terrifying sometimes when you pull up at home and you can't, you don't want to get out of your car. Okay, so we'll make sure, that's a priority for this committee, to make sure that we've got a phone number for lights out, and then if you could go back and run some numbers. And then lastly, on streets and lighting, Alderman Aldrich, did you have any questions for Director Wilson?
Was Alderwoman Sonia done?
She did, yes.
Okay. I can talk with the director offline. I got questions about contracts, and I don't want to
Sure.
take up too much of our time. I know
Oh, that's right.
in our inquiry we had with the earlier this week with Comptroller Green, there was a big issue with contracts and not getting processed in time, and I know some are in the streets department. And was
It might be, I think it might be actually under, Jamie's under traffic and lighting.
okay.
Traffic and lighting, but yes.
Okay, so I could talk to somebody offline just about the process of contracts and how we can, people that are going out for bid for those, how we can make that process more faster so that they can get paid on time, but I can talk with you about that later. Thank you.
All right, thank you, Director Wilson. And Commissioner, can you explain, yeah, it's okay. Yeah, never, Commissioner, excuse me, we'll just ride with it. All right, and then next up, do we have the 514 streets? Mr. Flake?
Good morning. I guess
Morning.
it's still morning.
It still is.
Ken Flake, Commissioner of Streets again. My 514 budget is actually pretty boring. And I gave 3 highlights here, and one of those was kind of a stretch. I'm actually going to start off in the second bullet point. The budget you guys have in front of you has a bunch of personnel changes. It's not supposed to have those in there. I believe that was an Oracle issue as they were being entered in. So I'm going to have to get with Paul Payne and discuss that after this meeting, because the personnel requested for FY24 should be the exact same as FY23.
Okay. When we're looking at the personnel, where are you looking at? Are you looking at 239?
I don't have page numbers on my
Okay.
copy.
We are. Yep, 239.
I was looking at both. They got 123 and 239. But you know what? Let's see. Let's see. 514, 135. Oh yeah, okay. So
Yeah, but
159 to 162.
yeah, and the actual breakdown's on 244. Most of it starts on 244.
$244 of the line item. Paul, are you in here? You want to speak to it?
Let's see, 244 personnel schedule, 244.
Oh, uh-huh. Okay, and so, Paul, do you want to speak to the issues there, or are you unaware? Oh, okay.
Yeah, we brought it up briefly in our previous budget meeting, but they were still
what's the
trying to
issue?
piece things together. We entered in FY '24, I think it's because all the programs.
So there's, you're saying you've got more than,
It should be identical.
Should be
to
one of them.
requested.
yeah, and what Commissioner's referring to is that we have a new system, the new personnel system. Where previously, everyone had to start from scratch and enter in everyone's name and everything. The new system automatically uploaded it. And so, and then also the fact that if there was a position that was spelled differently or the grade was represented differently, it was sort of, there were a lot of departments encountered this when they were putting their budgets together. So if there's something that, so that we've heard it from a few where the TO may need some adjustments, and that, I think, was what you're referring to.
Absolutely.
So that's not a major budget issue, but it's.
Okay. And are you a commissioner? Commissioner Flake? My apologies. Can you describe briefly like what you're over, the streets department?
Yes, so like the kind of refer to as the street maintenance. That makes it a little simpler for everybody instead of the street division. The street division gets confusing, but the street department. So street maintenance, we're in charge of pothole patching, street paving, street cleaning, snow removal. We remove all them pesky leaves in the fall. We actually have the flood control system also, so we have a levee/flood wall system that pretty much runs from South City to North City. That's under our purview. We do a lot of concrete work. Pretty much any actual maintenance of streets, sidewalks, curb, or alley falls underneath us in general, unless it becomes a bigger issue where the director's office, like the sewer lateral program, would have to jump in to repair something.
And how much of that work, the potholes, the paving, the concrete work, et cetera, is done in-house with the city employees versus contracted out?
All of our actual work is actually done in-house until it would reach that point to where we were contracting it out, like the sewer lateral program, but that's 514 street maintenance does all of their own work. If it needs to go further than that, it's contracted out by 510 or the director's office.
Okay, so the street maintenance budget overall, what is that? What is the maintenance, what is the budget the city has for street maintenance? Where are we looking at that?
Like it's proposed for $8.25 million.
Where are we at?
I believe that's page 240.
240. 8.5 million is what is proposed for street maintenance. Okay, that's up like 0.5% from last year. Your requested budget was 10 million. Can you talk to us a little bit about what you requested that is not in the proposed budget?
Most of that's employees. The only thing that was cut at all was budget 1,000, the account 522000. It was requested for that to raise 200,000, and that's for our asphalt patch material for patching potholes. We requested $1,475,000. Last year was 800,000.
Where are you at? You said a lot of numbers, but I,
230, page 239,
okay?
about 2/3 of the way down, line 522000, facility and ground supplies.
Okay,
It was requested for a little over 1 million. The proposed is 800,000.
okay. So that's, but your requested budget's $2 million less than what you're getting. So you got a $200,000 shortfall in pothole repair. That's that's the materials for pothole repair, is that correct,
Yes.
Commissioner? Okay. Okay. We got a lot of potholes.
Yes, we do.
Okay, so,
And not many people to fix them.
yeah, okay, that's very true. So we've got a little shortfall in the equipment for pothole repair. What else?
I mean, salaries by themselves is off by, per request, and is different by, what, 800,000? was also requested to go up almost 2 million from, I'm on the wrong year. Or 1.5 million between 23 and 24 is requested to go up 1.5.
Okay, is that salaries for like an increase, or is that increased personnel?
Yes.
Commissioner, do you mind speaking into the microphone? Sorry to remind you for the folks at home.
Yes, it was both salary increases, and I think the way that Oracle glitch works out, because it was actually cutting utility workers and adding those to actually higher end jobs when they should have been on utility workers. That's kind of a weird glitch there.
Okay.
They actually changed utility workers by several, and utility worker is the labor
Okay.
position we have. And they actually cut that substantially, 6 positions, and somehow those went to much higher level jobs.
Rather than the folks filling the holes?
Yep,
Okay.
yep, and that's why I want to make sure that we get the budget back to where it was FY '23 versus what's reflected here in FY '24.
Okay, so we can actually have the people out there putting the asphalt in the potholes?
Absolutely.
Okay, but you're still short manpower on what you requested to be able to handle the pothole load? Is that, I mean, we have just an absolute ton of potholes.
Yeah, I mean, currently we're running about 100 employees out of almost 160. I believe it's 157.
Okay,
Which is 38% short. That's been going for approximately 3 years.
okay,
Finally, here over the last 3 months, we've seen actual lists coming from personnel, and I think it's really starting to open up. It's not going quick, obviously, but it's starting to open up, and we actually have candidates to interview. Honestly, I haven't really messed with our personnel schedule at all over the last 3 or 4 years, knowing that we're 50, 55, 60 people short.
okay.
Seems kind of silly to ask for more people when I can't fill the positions I have. So I haven't really messed with that number. But hopefully, come this time next year, hopefully I'm up closer to 140, 150 people out of this 160. And then I can start thinking about adding labor positions in hopes that we can actually get back up to staffing where we should be.
Okay. I'm going to ask some more questions for you, but I'm going to turn it over to my committee. Alderwoman Boyd?
So I'm gonna ask Jamie, do you all have a schedule on how you are, and I'm assuming, you know what assume means, were you doing the, because I heard earlier in the director's presentation about the bike lane, whatever you all do. But do you have a map, or do you have a schedule on what area you're covering with the potholes? Do you have an area you're covering? I mean, do you have a map that's saying we're going in this area, we're going in this area?
We typically send our crews to using the old ward numbers, the old ward number that has the actual most complaints in it as of today. So if I have 3 crews available, and I'm just going to use old ward numbers, or 1, 7, and 15 have the most number of potholes in them, that's where they're going to go today, because it's much easier route, and we get more bang for their buck that way. With that being said, though, we always prioritize our major streets first. So if we got potholes in Kings Highway, Goodfellow, Union, the crew's going to go there before they go start taking care of residentials or alleys. Just because hitting a pothole going 50 mile an hour hurts a lot more than hitting a pothole going 12 mile an hour.
Right. And so my other question was, you're over the debris, right?
Yes.
Okay, which didn't make any logical sense on why that was done, but, I mean, I'm just saying, Ken, because it's like, forestry is like a one-legged paper hanger, one-arm paper hanger, because it's like they never can get stuff cleared up. Once they put the stuff down, they send you the list, and you're behind trying to get the list. So it's not working. So have you all had any conversation and look how you will redirect this to make it better for forestry, you, and the community?
It works out exceptionally well if the communication doesn't fall through. The communication between streets and forestry has been definitely lacking. And we've had many meetings that you've been a part of.
Right.
And these meetings help things out for a few weeks, and then it kind of goes back to normal. We can pick up pretty much everything there is if we know about it. I mean, we pick up 25, 30,000 tons of debris every year. These little piles next to vacant lots after they mow are super easy. We just have to know about them.
So is it a way that you could come up, because we have had meetings trying to improve it, so is it a way, or you all think will be better, or is it a contact person, or the supervisor at the end of the day send you the list, or?
And that we've done that before, and then we stopped getting lists. Our best, I mean, and I don't like relying on CSB for stuff that the city's creating.
Right.
That seems very silly to me. You know, I'm gonna get with my two supervisors again today on this, because I know they have maps of where they're going, list of addresses of where they're going. We need to have those in advance.
Okay.
And we always need to have those in advance. 'Cause like I said, I've tried to, meeting a couple years ago, 25,000 tons of stuff is a lot of stuff. And that's what we pick up. And I don't even know how to quantify it. I quantified it once as like a rail car completely full that was like 350 cars long. And that's what we pick up every year worth of illegal dumping.
Okay.
So yes, we have the ability to pick it up. We just have to know about it. And there's got to be a better way to communicate this between forestry and ourselves. And all of my guys, for the most part, in debris, are with forestry's old debris program. So it should be really easy. It's apparently not that easy.
Right. And then on the striping, it's no list. You just, it's no rhyme or reason to where you stripe. It's just you stripe. I mean.
Striping as far as lane markings?
How do you come up with where you go to stripe? Like the bicycle lanes, the crosswalks, you know, how do you come up, what's your logic on where you going? Who on first, who on second?
We've got a normal plan of planned maintenance, then we have the CSB avenue for when people point out things to address those as well. So it's partly complaint driven and partly maintenance driven, but if that's something I can provide to you.
Okay, so I guess my question, because I keep hearing CSB driven, and I don't know if you all know, but a lot of times when residents are calling CSB, guess who they tell them to call? The auto person. And so I can't tell Ken where to go pave a street or Jamie where to strike. So I'm telling them, no, you need to call back and say, we need this street paved, and get a complaint number, because I can't do it. That's not my authority. So that's why I'm just trying to figure out, is it a map or something that's saying, this is, you know, we'll cover this area and we got complaints about striping over here or whatever. That's what I'm trying to get a clarity on.
We don't have a map like that readily available that would layer on what's already been turned in and what's planned to do for regular maintenance.
Okay.
I'd have to wrap my head around that one, if it'd be too much detail at once, or if there's a way to do that.
Okay.
Let me ponder on that one. I don't know as far as the paving, but the striping, let me ponder on that one.
Okay, all right, thank you. Okay. And is this just a kooky question? Board Bill 184, 86 million. It says, and I say, paving Mare Street.
Means major. I don't think that we're spending that much money paving
I
the
was
mayor's
like,
street.
I think that was a misspell. So that's all I have. Thank you.
Thank you, Alderwoman Boyd. Alderwoman Saunier?
For me, The neighborhood improvement specialists have been super helpful with you all. In the 7th Ward, we have about 3 total to cover the full area. And I think I think a lot of people, and even me, I'm still gaining an understanding of, this request needs to go to this department. You need to get a reference number for this and all of that. But they've been a really great middle person in making it so that, as alders, we can do some of the other things and following up on those requests and telling constituents, hey, you need a reference number, or even locating, this number is already in the system, here's an update of where it is. So I haven't had as much interaction with your department yet because the neighborhood improvement specialists that I have are just like honestly amazing and super helpful.
Awesome to hear.
It's good to hear. Alderman Aldrich?
No questions.
Well, Commissioner, we want to make sure that we have what it takes to fill the potholes. Personally, okay, my axle broke in January. I hit the last pothole my car could withstand. So, seriously, cracked. But no, I mean, it's a complaint we get often, and you see it. It's a real problem. So if you could go back and make sure that we know, we can communicate with the director, the budget director on your personnel issue. We want to make sure you have the equipment and the personnel to fill the potholes, okay? We know we are a complaint-driven city, which is unfortunate. Many street maintenance departments have its own dedicated budgets to be thinking about a 10-year plan, a 5-year plan, and communicating appropriately to our residents what we plan to do. The city of St. Louis does not operate that way. We haven't ever, to my knowledge, in the time I've been down here. So that's not a complaint against you or this administration or anybody down here right now. It's just the way we've done business. But it's unfortunate because we really do deserve to be able to communicate to our residents, hey, these are the streets that are traveled down most, that get the most wear and tear, and this is how we're planning on paving them. It's how Clayton, it's how Brentwood, it's how most major cities operate. And so failure to provide you the budget to do that is really putting you in an unfortunate position. Recognizing that, we do lean on our ward capital for most of those paving investments. And we are not experts in street repair, okay? We're experts on knocking doors. And so that's really not the ideal situation, but it is the situation we're in. So we want to make sure that you at least have the budget you need to respond to the requests, the numerous requests that come in for the potholes and the maintenance that you get. So please get back to us on that. I did have an additional question, in addition to recognizing that you have less manpower than you requested, less of the actual material, the asphalt that you requested. There's also something that I'm unfamiliar with, which is the internal services gas. Okay, which you requested $1 million and we gave you 500,000. What is internal gas or services gas?
That's for our fuel for all of our trucks. The budget request, for some reason, essentially doubled. That's another Oracle glitch. We actually don't provide that number. Equipment Services through Board of Public Service provides that number.
Okay.
And somehow it just got quirky.
Okay, so you don't actually need $1 million in gas, but your gas budget did go down from fiscal year '23. And so is the amount you've got appropriate? I'm just looking at just because it was an anomaly here.
Yeah, I'm sure between Paul and Equipment Services that 516 is probably a fairly legitimate number.
Okay, great. Okay, all right, thanks, Commissioner.
Thank you.
Okay, lastly, everybody's favorite department,
Refuge.
one that gets the least amount of complaints, I'm sure. Refuse. Randy, to echo what Alderwoman Poit said earlier, you do an excellent job communicating with us and being responsive, and we're very grateful for that.
I appreciate that.
I mean, you have a very, very tough job, and you do an incredible job responding, and we're very, very grateful.
Thank you.
Okay, let's talk about your budget.
All right, well, good morning, everybody. My name is Randy Breitenfeld. I'm the Deputy Refuse Commissioner. Basically, what the Refuse Department does is we are in charge of servicing all the city alley dumpsters out there, which there's about 35,000 of them. We are also in charge of servicing all the roll carts out there, which there's about 43,000 of them. We also have a bulky operation. We work close with the debris crews for the street department, trying to get all the uncontained trash out of the alleys and the streets and wherever. And we also have I have 3 litter barrel crews that I run that pick up close to 2,000 litter barrels throughout the city. My budget increased by about $4 million this year. The biggest increase is our transfer station fees. I'm sure you're all familiar, our trash contract expires in about a month and a half, so we put that out to bid. The 2 vendors that we are interviewing, their tipping fees came back. Just to give you an overview, when we started this recycling program, I think it was back in 2010, we were actually making money off of recycling. The contract then got amended to where we are paying about $16 a ton for recycling. The new proposals coming back, the recycling is going to be about 1,000% increase. So that's one of the main reasons. Not just recycling, all 3 streams are really going up. So that was the reason that the additional money needs to be put into our transfer station disposal costs. The other big one is my overtime is doubled. We run about 55, we have 55 trash routes that we have to run every day. On a good day, I'll have 40 drivers. So every day we're starting out 15 to 18 open routes. The only way thank goodness, the only way I can make up that deficiency is we work on Wednesdays, Saturdays, and Sundays, which is all of our off days. My refuse drivers are 4 10-hour drivers. They normally, if everything ran good, they would work Monday, Tuesday, Thursday, Friday, and they'd be off Wednesday, Saturday, and Sunday. But due to the fact that we're so far behind, thank goodness I still get volunteers to come in. That's why our overtime is just through the roof. So until I get more drivers in, which with the raises and all that, it's helping. I mean, I am getting some quality candidates from personnel, thank goodness. So I'm hoping within a year we can maybe get back close to covering all those routes on a daily basis. My bulky operation, same thing. When it was running full steam ahead, I had 6 crews working south, 6 crews working north, and had 2 backup crews. Right now, I have 2 crews working south and 2 crews working north. So a typical alley or a typical bulk collection schedule, we would be in your ward for a week. We would be able to get it all done. It's taken us close to 6 weeks now to get through our routes with the amount of manpower that we have. And then the third big point is there's so many bad trash dumpsters out there. During COVID, we just didn't have the manpower, and we fell so far behind. So we were required to contract some of that work out. I asked for 300 in that budget, and I think I'm only getting the proposals for only 75,000. We depend on those guys like crazy. Last week, just alone, they went out and they were able to replace 144 bad dumpsters. Where if I was using my crew, that'd take us months to do that. So we really need that money in the budget until we can get.
Show us where that's at, Randy.
Let's see, that would be under professional services, it would be page, I forgot my glasses, I'm sorry, 250.
Okay,
Requested 300, they're proposing only 75.
okay.
So
That's the 566. Okay, this is for replacing dumpsters?
right, exactly. And until I can get my manpower and my equipment up to par, I'm gonna have to lean on those guys for a little while longer.
So Randy, I hate to ask you to clarify again, that these are contracted services
Right.
to go out and replace the bad dumpsters?
We did an emergency contract, back in, I think it was July of last year.
Okay, so these are the rotted out dumpsters?
We had over 2,000 service requests, and I had 1 truck that could maybe hold 6 cans and 2 people to try to do that, so we are never gonna get caught up.
Okay.
So we were able to get an emergency contract that it kind of goes in phases. But yeah, that's what those guys do. Just strictly go out. We give them service requests of where the bad dumpsters are. They go out and work off those lists.
It's a huge problem.
Yeah, it is.
But the bulk of your increase in your budget is for this additional contract, the contract for actually just disposing of our
Yeah,
trash.
just the tipping fees. All the tipping fees are going up like crazy,
Can you-
especially yard waste and recycling. Those are going way up.
Can you show us where that is in the budget?
Yeah, that would be,
Did this transfer station pick up? The 563, 504?
563, 504, yeah, it would be in Fund 1,000, and then there's also some money in there in Fund, I think, 1110.
Okay, so that's a $3 million increase out of last year for the, is that right? $3 million difference on
Yeah, it's,
transfer
yeah,
station?
So,
a little over 3 million,
so
actually.
this is the recycling that's.
That's
we're
the
talking
biggest
about?
cost, yes.
Okay.
That is
So
that's 1,000% increase on, pretty much close to 1,000% increase on both the bids we got back from our two haulers that we're considering.
So I know, about Kara might know better, 4 or 5 years ago, we were told that our recycling wasn't good because it was dirty. And so, is it still that way? And are we able to utilize the recycling? Because it doesn't seem like we're profiting from the recycling.
No, about 40% of it actually gets recycled.
Okay.
So that's what kills me, when my trucks go over the scale and we're gonna get charged 1,000% more for a ton of recycling, and then it just goes and gets rejected at the MRF.
Right,
It's
So
a
that's what I was
losing fight.
yeah.
But you know, we have to recycle. We just got to figure out how to get clean recycling.
So I know, was it last year, year before, Streets had suggested to move the recycle bins to the fire departments for people to go to recycle there. They figured maybe that was a suggestion. It might be cleaner, where you
Yeah.
all could get more bang for the buck. Did
Yeah, when we
ever
did drop off recycling only, our material was almost 100% clean.
Okay, that's what I thought. Okay, I just.
It only takes a couple people in the alley to ruin the recycle loads. And a lot of that has to do because, you know, until we get enough trash drivers, you know, some weeks we're only able to pick up trash once a week. And the way that those alleys were designed with the amount of dumpsters we put in there, trash needs to be collected twice a week.
Right, right,
And when those don't get collected twice a week, people throw everything in the green and the blue dumpsters.
right. Okay.
But like I said, you know, we are getting some better lists from personnel now. So I hope to see our TO get better here soon.
Okay, so, are you a commissioner?
Deputy Commissioner.
Deputy Commissioner.
Are you acting or real?
I'm sorry?
You are acting?
No, I'm the Deputy Commissioner,
Okay,
been
you are the
Deputy
deputy, okay.
94.
Okay. Sounds-
The real commissioner,
There is no real commissioner, it's vacant right now.
Okay.
deputy, okay.
Right.
Okay, so the refuse budget of 26,244,000, blah, 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 put us on track. I mean, Randy, you know this, the trash complaints are just astronomical. They're worse than I've ever seen. Does this budget give you what you need to be able to pick up?
Oh, yes, it gives me what I need. I got the manpower in the budget, I just gotta get the people to fill my TO.
Okay.
Right now, we're 33% short in our TO. I mean, I should have close to 150 people, I got barely 100.
Okay.
So that's the problem. I mean, the drivers and everything's in there, we just gotta get quality people to fill them.
The salaries that we've taken some steps in personnel to improve that, so you feel confident we're gonna have some more people coming in the door?
Absolutely. I already got drivers that left, call me back saying they wanna come back.
So
Okay.
are we still doing the bonus?
Yes, we're doing all that still.
Okay.
Yes.
All right.
And the one thing you do need, okay, is to be able to replace these dumpsters. I'm with you on that. I email you
I
a
know.
lot
I know.
about
I hate
rotted out dumpsters.
Right.
Okay, and it was my understanding we had 2 trucks that were able to take those 6 cans and put them out there, is that right?
I did, yeah.
And
but
one of them's been,
one of them's been out forever. It's been in the shop, just waiting on parts.
Okay.
We've been
Truck
waiting on
is-
parts for 6 months
Okay.
from the vendor.
and the other one is not functional right now.
That one
for-
got
okay.
surplus,
Okay.
taken out of business. So that's the main reason we had to hire outside work.
Okay,
But I do finally have some working equipment to where we can do some in-house stuff now, so.
And the good thing is you communicate, so you let us know, you'll say, I got a truck down, or this we doing, so we'll know what's going on. Yeah.
Yeah.
okay, so with this, this additional 225 for the dumpster, how many open service requests do you have right now?
We just got through running our first round. We went through every ward. I think we replaced over 2,000 dumpsters, and since we started that, we already got another list of close to 1,000.
Yeah, okay.
And that's
1,000.
just service requests. That's just people that call in and say, hey, my dumpster that's not
Okay.
every bad dumpster.
Okay. With this, with the personnel that you have, are we going to be recycling? That's a big question I get, what do we need to do to make our city more functional with regards to recycling? Is the pickup, is the fee?
We have to be able to get back to collecting. I mean, we need to run down the alleys 4 times a week. Go down there and get trash twice, yard waste once, recycle once. When we can't get in there and only get trash one time, then the dumpsters overflow, and then they start throwing it all in the green and blue.
Using the recycle and the yard waste for
Right.
trash,
Yeah, I mean, a typical LA dumpster service is 4 households.
yeah.
Okay. And is the pickup fee, is the transfer station fee, what is the difference? You said it went up 1,000%,
Well,
but
it
like.
hasn't yet, but the proposals that
Proposals,
we
sorry.
got,
Okay, so is it more, it used to be, like you said, we made money on the recycling. What is the difference between the fee for the trash versus the recycling versus,
it's like triple
which is more?
the recycle.
We pay more to dispose of recycling than we do
That's
for
what the-
trash?
Absolutely. Well, that's what the new,
Because he said once they weigh it, and then they go there, then they won't use it because it's dirt.
currently, it's not like that, but when we start our new contract here in a month, the
That's
2
how it's
companies that
gonna
we're
be.
looking at, it's all going up.
It's going to be more expensive to dispose of recycling material than it is of garbage.
Yes.
By what factor?
Trying to think what the proposals were. Probably almost triple.
I think that, being that we're still in negotiations.
Yeah, okay, we don't want to go into that, okay, sure, okay.
About the numbers, but we can show the numbers that we did provide Paul is based off of the increase that we are seeing from the proposals that
Okay.
we are considering. So it is a huge jump, and that's just across the board. As well as we need to know that that last contract we were working on was for almost 15 to 20 years with 2 5-year extensions. So we're going into a new process, and we're comparing to numbers from 20, 30 years ago
Okay.
now. So we will see that increase in the cost as well.
Okay. Seeing that we're at the end of our time, pretty much, and I've lost most of the committee here, and we have already discussed some issues that we're going to come back before the committee for. What I'd like to do is adjourn for today. We have some information to gather. I thank you all for your time and recognize that, you have a lot of work on your plates. We are, are grateful for what you're able to do, and we will ask you to come back before the committee to iron out these last little details, okay?
Could I just ask one question? Do you, is that under your venue where if it's a dead animal, somebody picks it up? Is that under you guys?
Yeah, that's us. That's me.
So, some years ago, somebody had called me and said that the truck wasn't covered or something. Did we ever correct that?
Yeah, we got a truck that's covered now.
Okay, because that's
But
what
I
was
still do
wondering.
need a better vehicle, but right now, what we have works, and it is
Okay.
covered, yeah.
So, do you have that vehicle in your budget to request that?
I've requested that now for quite a while, and I still haven't got no movement on that.
Could you request it again, please? Thank you.
Yeah, we really need a nice refrigerated truck
Yeah.
for that.
I'm just concerned about the employee that's driving the truck, and then, to make sure that, you know, safety-wise, we're making sure they're okay. Okay.
Yeah.
Thank you.
Okay, you're welcome.
Thanks, Randy.
All right, with that, I'll take a motion to adjourn from the only member left.
Second.
I'll second it. And we will reconvene. Okay, thank you all.